Okay, I think it is recording. Let me get my voice recorder turned on just in case. Okay, so and just as a reminder, if you're not talking, keep yourself on mute. That way we don't get any background noise. I think that should help so that we can all hear each other pretty well. Look at Dr. Underwood's cat. And then I think I'm going to go ahead and put myself on mute, and Dr. Parker, if you want to go ahead and I don't know, maybe do a roll call and call it to order just so we make sure we know who's on the call here. So.
Okay, let's go ahead and get started. I'm going to call this meeting of the Arkansas Veterinary Medical Examining Board to order this morning at 9 a.m., April 30th, 2020. We'll start with a roll call of the board members. Dr. Turchi.
Present.
Dr. Bird. Dr. Underwood.
Here.
Dr. Bird, are you with us this morning?
I am, but you
All right, very
blanked
good.
out. I wasn't sure you were calling my name.
Okay, very good. And Mr. DeSalvo, I believe, is not present with us this morning. And then myself, Dr. Doug Parker. So we have 4 board members in attendance to the meeting, Executive Secretary Kara Tharp, and our legal counsel, Mr. Michael Bynum. I trust that everyone has received a copy of the agenda that Kara was nice enough to send to everyone. If you have your agenda with you, I would urge you to keep it where you can see it well. And I would like to also make a note that the Zoom meeting, although it's working, may slow us down a little, but I do, there is a time frame. We need to stay efficient with our meeting this morning and move right along, keep the discussion very, very pertinent and not be going off in left field on certain things, and just stay with each point very efficiently. So starting with that, if you'll look at your agenda, first item on the agenda is to approve the board meeting minutes from our last meeting, which was February 19th, 2020.
This is Dr. Bird. I make a motion we approve.
I'll second.
Okay, we have a motion and a second to approve the meetings. All those meeting minutes from last meeting, all those in favor say aye.
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 Okay, so the minutes are approved. We'll move on to agenda item 2B, which is to approve the fiscal year third quarter of quarterly report. And I trust
Dr.
everyone's
Bird, I
seen
move
that.
that be approved.
Second.
Motion and a second. All those in favor say aye.
Aye.
Any opposed? No. Okay, continuing education is the next item. I think that Kara has sent us all via email our continuing education. Kara, do you need to say anything about these?
Normally what I do is I just read through the list of meetings that you've already approved, so I'll do that. So we got sort of inundated with a lot of requests for webinars. That since no one can meet in person right now, and so I'll just kind of go through the list of what we received. So Elanco orthopedic video series, that was 1 hour. Elanco appetite and outcome addressing inappetence early, that was 1 hour. Pause Consulting LLC overcoming COVID-19 overwhelm, 1 hour. Zoetis implant technology that lasts all season, 1 hour. Zoetis advantages of intranasal BRD vaccination, 1 hour. BI, Boehringer Ingelheim, new data in BRSV, early vaccination and how we can influence health, 1 hour. The Arkansas Poultry Veterinarian Association, they were going to do some case presentations. That was approved for 3.5 hours. I assume that was, or I know it was canceled. I assume they're going to do that at some other point, but that was approved whenever they decide to reschedule that. Zoetis beef cattle parasitism, that was 1 hour. Zoetis Big Cedar Educational Conference, that was 11 hours. 1 hour was medicine surgery, 1 hour, or 10 hours of medicine and surgery, 1 hour was practice management. I did talk to Steve Markham, and I think they moved that to a virtual meeting, I'm pretty sure. So I think they still did hold that.
I did.
Yeah, that's what I thought he said they were going to do. Let's see, Zoetis using new strategies to design vaccination programs for beef calves, 1 hour. Zoetis meaningful differences in herd immunity, 1 hour. Bayer, the ins and outs of otitis externa, 2 hours. Zoetis, BVDB, just when you thought you had it figured out, 1 hour. Zoetis BRD, treat early or treat often, 1 hour. Burback, canine osteoarthritis, get moving with Movoflex, 1 hour. Zoetis, getting the most out of your reproductive vaccine program, 1 hour. Zoetis BRD diagnostics, what's your plan, 1 hour. And then finally, Elanco, flattening the curve, pathogen dynamics and mitigation in cattle, 2 hours. So the Zoetis cattle group submitted quite a lot of live webinars, and they've been having a lot of those meetings. So I think that takes care of it, though, for the continuing education.
Okay, we've all heard those. I make a motion we accept I don't know if we need a motion. They've already been approved, right, Kara?
Yeah, it's just a
Right.
review.
Okay, I make a motion that everything's in line with those. Is there a second?
Second.
All those in favor say aye.
Aye.
Any opposed? All right, very good. Next item is to review issued temporary permits for veterinarians.
Yeah, I'll just go over that list real quick. So these are temporary permits issued since the last meeting. I've got Rachel Myers, Dr. James Williams, Dr. Priya Kingathi. I'm not really sure if that's how you pronounce her last name. Dr. Tanner Roberts, Dr. Cassie Park, Dr. Noah Grimes, Dr. John Lazenby, and Dr. Christine Eves. So there were 8 temporary permits issued since the February meeting.
So these would be all veterinarians who have not applied for by endorsement, and they're expected to take the state exam when we have one.
Yeah, Dr. Myers, she actually was issued licensed by endorsement at the last meeting, but there was like a little time lag in between there, and she had already applied for a temporary permit. So that was issued, but she does have a license now through endorsement. But yeah, everybody else on that list, I believe, should be someone on the list to take the exam.
And they have met all of the proper requirements with your office at this point in order to get a temporary permit. Is that correct?
Correct. Yeah, the only one that was a little out of ordinary from what we normally have, Dr. Priya Kingathi or Kingaith. I'm not sure exactly how you pronounce her last name. She is a foreign veterinary graduate, but she completed the ECFVG program and was able to submit that certificate that she completed that and met all of those requirements. And so I believe she graduated from a school in India. But she did meet all the requirements to be issued a temporary permit, and she'll sit for the exam.
Okay, very good. Is there a motion?
Motion to accept.
A second? I'll second. Is there any further discussion on the temporary permits issued for veterinarians? All those in favor say aye.
Aye.
Any opposed? Okay, let's move on to veterinary technicians.
There are 3 that have been issued certificates since the last board meeting. None of these were new graduates. These were all folks that relocated to the state of Arkansas, so moving from other states. Amber Russell, she was a graduate of Murray State College and was relocating here. Melissa Cowell, she was a graduate of Carrington College in Sacramento, California, relocating to Arkansas. And then Jessica Reed, a graduate of Crowder College. That's
Okay,
it.
very good.
Commissions.
And again,
Move they
Nathan
be
Mel.
accepted.
Okay, we have a motion.
Second.
All those in favor of the motion, say aye. Any opposed? All right, motion carries. That'll move us on to corporate practice applications. And I believe that we've received a email, and that's one of the agenda items on our electronic email that we received from Kara. And so if you have those in front of you.
Yeah, there were 3.
Start us off with one, Kara.
Yeah. So there were 3 corporate practice applications received since the last meeting. The first one was Jones Veterinary Services, PLLC. The next was Kate Spiller, DVM, PLLC. And lastly, Nashville Animal Hospital, Inc.
I would make a motion that we approve all 3.
Second.
All right, a motion and a second. Any further discussion by anybody? All those in favor say aye. Any opposed? Okay, let's move on to veterinarian's license by endorsement, please. And again, I'll ask Kara, will you start us off with one, please?
Sure. So I have 7 requests for license by endorsement. We have Mikhail Orchard. I have a fully completed application on Dr. Orchard. The next one, Dr. Frank Pace.
Do we need to do these one at a time?
I guess we can. I was going to kind of make mention on kind of application status in each one, but if you want me to just do it individually, we can do it that way too.
I would move that we approve Dr. Orchard.
Second.
All right, all those in favor of Dr. Orchard say aye. Any opposed? All right, let's move on to Dr. Pace.
Okay. So Dr. Frank Pace, I do have his complete application, but would point out that he's had disciplinary action in the past with Texas and Colorado. Those were actually connected to each other. I think originally he was disciplined in Texas, but then I think there was a violation in Colorado also. Or maybe it was the other way around, but one state disciplined him and then the other one did it because, you know, it happened in another state. So
I make a motion we disapprove Dr. Pace and then extend an invitation to him to sit for the written exam.
Okay, there's been a motion. Is there a second?
I'll second it.
Okay, we have a second. So let's have some discussion. Dr. Bird, why would you like to expound on why you made that motion?
Well, according to our rules and bylaws, the fact that he's had a sanction in another state disqualifies him for endorsement. And if you look at the deal, you know, it's a crazy deal that could have happened probably anywhere, but he was relying on information from a inseminator reproductive group, and the rules in Texas where he was doing this that didn't allow for that.
What specific part of the Practice Act are you referring to that you say disqualifies him from endorsement?
Pull that up. Any time in the past when someone was disciplined in another state, we disallowed it.
yeah,
I think Dr. Bird is looking at 303B.
That is correct. We've had a few this past year that have had this in another state, and we have denied the request for endorsement. You know, I think going forward, once our reciprocity is in effect, I think we won't be doing that anymore, but that's what we've been doing historically.
And moving forward, that process, Kara, what you're talking about, the reciprocity is not exactly in force at this point. Is that correct?
I know a lot of other licensing boards, even though they don't have their rules finished, are already sort of following what the rules are going to be. I don't know, Brad, you have a little bit more information or some comments on that. He may know of other boards that are doing that. But I know of a few in particular that have decided to go ahead and sort of move forward with the current status, even though the rules are not finalized, because that's been a process that's been, you know, taking some time.
Yeah, and
Mr. Blunt, go ahead.
yeah, thank you, Dr. Parker. The reciprocity statute, Act 1011 and Act 426, they went into effect on July 1. Statutes always control over rules. I would recommend the board can follow the statute until we can get the rules caught up to where they are. So I think under the new reciprocity rule, we would go ahead and issue a license by endorsement. I think Mr. Bynum agrees with me.
And just to clarify with the new reciprocity statute and your accompanying rules, you know, reciprocity would be potentially denied only for a revocation, which is based on an act of bad faith or a violation of the law. So if they're reading that, if there's a disciplinary action which led to a revocation, well, then naturally that revoked license would not, or possibly even a license that was revoked and then reinstated later on. You know, you could probably ask them to reapply and sit for the exam and things like that. Brad, that's a long way of saying Brad is correct.
So in this case, the license was not revoked. He was penalized with a monetary fine, and he complied with the order, completed everything, and that was 7 years ago, and he's been in good standing as far as we know since then. Is that correct, Kara?
That is correct.
Okay, so Mr. Nye, your and Mr. Bynum's recommendation would be to, again, tell us why we're going with the statute and not the rule. Is that the case?
Dr. Parker, the statutes always control over the rules, and that statute went into effect on July 1. So I think we'd be in a better legal position to follow the statute. And then once the rule catches up, we won't have these issues. For the time being, the statute controls.
So the statute being in effect since July 1st would say it's, unless he is still in violation of something, then we should go ahead and allow endorsement of his license request.
Do we have a copy of that? The only one that I seem to have is the military.
Oh, reciprocity. Well, we didn't receive any public comments on the reciprocity rule, so I didn't send a new copy, but I know we probably had it for past board meetings. And since we really haven't been following, I didn't include a copy of it this time. And I mean, that's in a part of the statute that's separate from our Practice Act also.
Okay, well, I don't seem to have a copy of that.
Yeah, the statute itself, I'm not sure that I'd have to look back. We never actually had a copy of that piece of legislation. It's not found within our Practice Act, so my guess is that you may not have had a copy of that.
So am I hearing that if anyone has a valid license in those states that's not been revoked, going forward until we change rules, we're going to fully accept the application.
As I understand it from our legal counsel, Dr. Byrd, I believe that's what they're saying, unless they're still in violation some way, or if they're under an order of revocation at the time. So if they've had a violation in the past and taken care of it and now are in good standing, then it would be our duty to go ahead and endorse their license request.
Correct, and it's codified at Title 17, 108, and I'd be happy to share that language with you, Dr. Byrd. But essentially, if you hold a substantially similar license to practice in another jurisdiction, your license is in good standing, it's not been revoked for an act of bad faith or a violation of laws, rules, or ethics, and it's not in a suspended or probationary status, we would grant them reciprocity.
Given that explanation, I'll withdraw my motion and move that we approve.
Okay, there's been a withdrawal of the motion and a new motion to approve. Dr. Pace, is there a second?
Second.
Okay, we've got a second. All those in favor, any further discussion on Dr. Pace? All those in favor of the motion say aye.
Aye.
Any opposed? Okay, let's move on. Kara, who's the next one?
Okay, Dr. Crystal Whitehead. I also have a completed application on her. I'm not waiting on any other items.
I make a motion we approve Dr. Whitehead for endorsement.
I'll second that motion. Any further discussion on Dr. Whitehead? All those in favor say aye.
Aye.
Any opposed? Motion carries. Okay, Kara, who's next?
Dr. Antoinette Markin. I have a complete application on her, and also many, many years ago, she did previous license in Arkansas.
I make a motion we approve Dr. Market
Second.
endorsement.
All right. All those in favor of the motion on Dr. Markin, say aye.
Aye.
Any opposed? Motion carries. All right, Kara.
Okay, the next one is Dr. Allison Marsh. The only item I am missing from her file is the license verification. And those Maryland license verifications take a long time. So that's the only pending item that I've got to complete her file.
This
I
is
have
the
a
veterinarian that
question.
had like 20 licenses and all the other 19 or so were verified, correct?
Right.
Yeah, she I can't remember if it's that she works for Petco or Banfield, but it's one of those larger groups that she works for, and so
Both
it
of
is
them.
not common to see them licensed in like literally every state.
And this brings up the question, given what has been stated about this reciprocity, is even without having received Maryland, and I don't see on her list that she's ever actually practiced in Maryland. Is there any reason that we would even wait on the information from Maryland since she has a valid license in another state?
That's a good question. I'm not sure on that. I know we require verifications from any state they've ever been licensed in as part of the application process.
Right. But that was prior to the statute that we were just read.
Yeah, technically, I mean, we've got, gosh, like 20 other verifications in good standing, or however many it is. So my guess is that the Maryland will come back with no issues also. So
You
And
you say Maryland takes quite a while. So when did you submit approximately for that request?
well, she it's on the licensee to request those. She actually went through the AABSB, kind of their beefed up transfer request, which is not just transferring the scores, but it's the whole, like they request all of the information, the license verifications, everything. And I did talk to AABSB just last week to follow up on it, and they still have not received it. It usually takes 6 to 8 weeks for some reason for Maryland to do those verifications. I don't know why.
Well, to simplify it, I'll make a motion, we approve it pending the information from Maryland.
Second.
Okay, motion and a second. Any further discussion on Dr. Marsh? All those in favor say aye.
Aye.
Any opposed? Motion carries. Okay, I believe that brings us to Dr. Eves. Is that correct?
Correct, Christine Eves.
Okay.
And her application is complete. I have all information.
Make a motion, we approve the endorsement.
Second.
I'll second. Okay, all those in favor say aye.
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 Aye. Any opposed? Okay. Is that the last one, Kara?
I've got one more, and that was Dr. Shelley Felinius, if that's how you say her last name. I am missing her license verification from California. California is another one that takes an extremely long time to get verification from. So,
I
but
make a motion, we approve it pending the receipt from California.
I'll second. Okay, we have a motion and a second. Any further discussion on Dr. Telenius? All those in favor say aye.
Aye.
Aye. Any opposed? Motion carries. Okay. That moves us on to rules on our public, review our public comments. So Kara has been nice enough.
Wait just a second. You skipped number 4, complaints.
I'm sorry. All right. Thank you for reminding or pointing that out. I was just going to do without those, I guess. All right. Moving on to complaints. We have some updates on existing case files.
Yeah. So the first update would be for Dr. Mike Gillum, and he may be on.
I'm here.
You're here, Dr. Gillum?
I'm here.
Okay, great. Dr. Gillum did send me a letter regarding his federal probation ending. I believe April 16th. So he is done with that. So since he's on the phone with us, I guess I'll just let y'all see if you have any questions for him.
So Dr. Gillum, I guess is what we've been informed of is that your case is over and you finished all of your commitments that were imposed on you, and so somewhat the case is closed. Is that correct?
Yes, sir.
Okay, so there's no other legal duties that you have to finalize that. Is that correct?
No, sir. No, sir. Everything's finished.
Okay.
I make a motion, we close Dr. Gillum's case.
I'll second it.
Second.
Okay, there's been a motion and a second to close this case with Dr. Gillum. Is there any further discussion? All those in favor say aye.
Aye.
Aye. Any opposed? Okay, Dr. Gillum, I think the board is comfortable and very happy that the case is closed and resolved, and I guess I would, on behalf of the board, wish you a very happy and comfortable future away from legal problems. Okay.
Thank you guys very much. Y'all are very patient, and I really appreciate all the input, and hope not to see you very soon, except at a social gathering.
Thanks.
Very
Y'all
Dr.
have a
Gillum.
wonderful day. Thank you. Bye-bye.
All right.
Thank you, Kara.
Thanks.
Okay, Kara, who's next?
That brings us to Miss Nikki Penny, certified veterinary technician. I received a negative drug test for Miss Penny February 27th. Dr. Beard has reported that she is doing very well, and I've actually talked to her on the phone a few times. She sounds really good. But Dr. Beard did report that to me on a phone conversation, so I don't have a written statement from him, but he and I have talked about her and how well she's doing. And I think really at this point in time, all terms of her consent agreement have been met. And so I think at this point it's closed. She's complied with everything, and it's been the full 12 months. So I don't know if y'all have any other thoughts or comments on that.
Well, I guess I would make the motion that we consider the terms of the consent agreement complete and close the case. Is there a second?
I'll second it.
Okay, there's been a motion and a second regarding Mrs. Penny and the consent agreement that's been in effect for a little over a year now. Is there any further discussion on Mrs. Penny? All right, if there's not any further discussion, all those in favor say aye.
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 Any opposed? Okay, motion carries.
Okay, moving on. The next one, Dr. Holly Dorosky. She had negative drug tests in both February and March. I've been kind of watching it for the month of April. She did miss a call-in day this month. I contacted the provider that we use. I tried to get in touch with her a few different times, and actually late yesterday afternoon, she called me. So I did speak with her yesterday. She was headed to the testing facility in Little Rock to get a drug test. But she and I talked for a while yesterday. And I do think that it's almost coming up on a year for when we did her consent agreement last June. And so I know she's got to meet with us in person. So I think at the next meeting, I think if that'll be, if we'll still be doing it this way. But she knew I'd be making a report to y'all this morning. And so that's where we are on it.
Is this I believe this is the second time that she's missed a call in this year, or during the 12 months?
Yes, it is.
Yes.
It is, yeah. She missed the test in December, and made 2 tests in January. Of course, I reminded her that was really a violation of the consent agreement, and that, if she missed a test again, that was not going to be good. So, and I don't think Dr. Beard's been able to talk to her either. So anyway, I think it might be good for the next meeting to definitely make sure we have some face-to-face contact with her. And like I said, I'm assuming she did get the test yesterday. I don't know what the results of those are going to be. I probably won't know for a few days. But that's what the situation is.
Is she not employed as a veterinarian at the moment?
Dr. Bird, to my knowledge, I do not think that she is currently employed. I think she was, but I don't think she is now.
And the process is that each morning, she would get up, make a phone call to the testing facility, and supposed to make one every single day, correct?
She is supposed to call in every day by 2:00 p.m.
2 o'clock. Okay.
Yeah, when I found out that she had not, that she had missed her calling day this month, I asked the company to schedule her again before the end of the month. And then that's when I started to attempt to make contact with her, which was difficult. Like I said, she finally called me back yesterday, late afternoon.
Mm-hmm. Whenever you talk to the testing facility, Kara, does it appear like she's calling in every single day, and then by chance, the one day of the month that she chooses not to, that's when a test is requested? Or is it that there's multiple days that she's not calling in?
I don't know that for certain, but my guess would be that, and I may be able to find that information. I'm sure they can send me a report or something, but my guess is that she's probably not calling in every day. I know when I spoke with her yesterday, I think she's had some phone issues. So I don't know.
Does she hold
But
a
I
temperature?
think that, you know, no, she did when all of this began.
Mm-hmm.
And then, you know, she went through all of her, you know, all the court mandates and that sort of thing. Because she had, you know, if you'll remember, she had a felony charge against her. And she went through all of the, you know, court orders and the rehab was well. And then we asked her, we met with her last year. It was probably around this time. And then we asked her to sit for the exam last June, which she did and got a license. And, you know, at that time she was doing well. So,
Mm-hmm.
but I don't know.
And so she was headed to take a drug test yesterday, supposedly.
That's what she told me.
Okay. I guess I would make the motion that we request that Dr. Drosky be at the next board meeting. And I'd also like to know a little bit more specifics about whether she's actually calling in each day or if there's multiple days.
Sure. I can
Okay.
I can definitely see if there's some type of report that I can obtain to just see how many days she's not calling in. Because really, I just email back and forth with the customer service representative, but I'll see if there's a way to get a report.
Okay.
She needs to know that this is unacceptable.
Yeah. When I talked to her yesterday, I feel like I relayed the information that this is not good. So.
And what are the length of time on the consent agreement that we previously given her? What is the length of time, or when does that run to? Do you have an idea, Kara?
Yeah, let me.
We're still within that time frame. We're not getting near to any kind of end of it necessarily, are we?
No, I think if you'll just a second, let me.
The drug testing and the requirement to attend Al-Anon, and she was to report to the board in person within 1 year.
Okay.
Yeah,
And
we're coming up on that 1 year mark.
Okay. Well, I'll still make the motion that we sit and visit with Dr. Drosky at the next board meeting. And you're telling me, Kara, that she's already been told that it does not reflect positively upon her by the board. Is that correct?
Right. I explained when I had her on the phone that you know, if she missed a drug test, that was a violation of the agreement, and that would not be good. And the fact that you know, she was allowed to kind of make one up last time, that was not this time.
Mhm.
And so, and you know, she did good for a couple more months. So, but I think, you know,
I guess
I
you
mean,
made a mention that she, Dr. Dr. Beard, hadn't been able to visit with her. And why is that?
I don't know. I don't know. Whenever I couldn't get a hold of her, I did ask him to try to get in touch with her, and he was not able to either. So,
Okay, I understand what you're saying.
yeah.
she, she has violated the consent agreement. And the
Technically,
only,
in December. Yeah.
and well, and again, by not meeting when they called this month on the front end, even though she's taken a subsequent test, that's not a substitute. And I just asked the legal question, if we get out to the year, is there any way it can be construed that we accepted this behavior, or that she would be complete because she's past the end of the year?
No, I don't think so, Dr. Bird. The 1 year requirement was just that she come before the board so that we could gauge how she's doing with recovery. The consent agreement is for a period of 2 years. So I think we still have the ability to move forward with the disciplinary action if the board could so choose based off of the language of the consent agreement. And I think that'll be something that Michael might be handling, so I'll be happy to let him weigh in.
Mr. Bynum, I think you're still on mute.
Thank you. So generally with consent orders, in order to waive a requirement, you'd have to take a specific vote on that and amend the consent order. And it'd have to be agreed to by both parties. That would probably be our legal position. But at any rate, there doesn't seem to be anything that is indicative that you've waived any requirement. Just simply that you have not taken further action on a violation, which there's no really any time limit where you could do that. But at the same time, you're going to have options whenever the year comes up. So, and like Brad said, according to the terms of the consent order, those are pretty broad. Whether it's extending a consent order, if you wanted to move on to some more formal disciplinary action, absent a consent order, those are all things to consider.
Okay, at this point, is her license under revocation, or is it under, well, when we don't revoke it, we suspend. Is it under suspension or is it under revocation?
No, I don't think, Brad, you can correct me if I'm wrong. I think you and I talked about this, but we didn't put anything in the consent agreement that would allow for an automatic suspension or revocation if she violated the consent agreement.
That's correct. And when she sat for the board exam, we issued her a full license. So if the board decided to move forward with a disciplinary action, I think due process would require that we take her to a full hearing on the issues.
Okay. So really, Mr. Nye, it seems like she's in violation of the current order. We all know that she's in violation of the current order. She's not employed. She has a license, but in order to change that license status, we're going to have a full hearing, and that's not today. Is that right?
That's correct. I mean, the other alternative would be if the board wanted to offer her a consent agreement, again, something with a suspension or a probationary status, or to extend her requirements for Al-Anon and the drug testing, that sort of thing. But short of that, we would have to send her the 30-day notice for a hearing and have her come before the full board.
Okay.
Dr. Parker, I think we're at the point with her in particular that we need to move towards a full hearing. I don't know where that puts us with the COVID-19, situation, but she has clearly missed the terms of the consent agreement, and she is not complying. And the fact that it's been difficult for Kara and Dr. Beard to reach her, barring that we get a clean letter from Dr. Beard that, in his opinion, she's doing really well. I think we need to move forward with a formal hearing. If we allow her to continue in this behavior, her initial charges were pretty grievous. And she's obviously, if she's unemployed, she has no reason to miss those call-ins.
Mr. Nye, is it within our power to offer another consent agreement now for suspension of her license at this point, based on that she's violated this current agreement, and she would have 30 days to accept that, or we're going to see her at the next meeting? Is that a process that we could go down?
Yeah, it is consent agreement by agreement of the parties. We could certainly do that, and I think it would probably be it wouldn't be a bad thing to reiterate to her the importance of making sure she shows up for the drug test and checks in with Dr. Beard. I think it would be a good thing before we move forward with a full revocation, if you want to give her a chance to comply.
Mm-hmm. Well, I guess I'm thinking, I hear Dr. Bird with the formal hearing and everything. It may be difficult to accomplish that. It may not. I think it would be. I'm kind of thinking a little different path maybe than Dr. Bird. I agree with him that she's obviously she's not in compliance with the consent agreement. So I guess I would make the motion that the license that she received this last year after taking the test be suspended, and that she meet with us at the next meeting to discuss her deficiencies in the present consent agreement. And if she accepts that consent agreement, fine. If she doesn't, then we'll call for a formal hearing.
Can we suspend a license without a formal hearing, though?
No, you need to have a formal hearing for that too. But you could have a consent agreement where both parties agree that her license is suspended for a particular time. This is one of those situations where, like everyone pretty much on Zoom call has said, is that, violated the consent agreement. We've tried to work with her in a remedial fashion. Kind of the next step is a license suspension in our mind. If we can't work out something with that, with whatever additional terms that may be acceptable, we may have to consider other options, more permanent options. Yes, I think consent order, we don't need a hearing. If we're going to compel a suspension unilaterally with the board, we'll need a hearing on that.
Okay, well, I'm going to withdraw my motion, and I'm going to say I make a motion that we require that she's at the next board meeting, and we'll discuss the deficiencies in the consent order, and then based on that, we'll decide if we're going to proceed further with any other consent agreement.
I'll second that.
Okay, there's been a motion and a second. Any further discussion?
I'll make the notation that I'm going to be opposed, but it's on the basis that she's already violated the terms of the consent agreement. And in these situations where we've given her a clear chance, I think we're doing her a disservice as well as the public to allow her to continue.
Okay, well noted, Dr. Bird. I think all of us agree with what you're saying. I just think that we don't have very good avenue of which by to pursue things at this time until we get her in front of us. And the next opportunity that I see that we could get her in front of us would be at the next meeting. So with your wisdom that you've mentioned to us, I agree, but I'm going to say continue with the motion that we've made, and we have a second. So is there any further discussion?
Can I make sure I understand what the motion is so that I've got it written down correctly? But what I understood was that at this point in time, we are not going to offer a new consent agreement. Is that correct? That we would have her come to the next board meeting and discuss her deficiencies with her at that point? Or did I take that down incorrectly?
No, I think that's the motion. And I guess the motion was that because I didn't think that there was a good way for us to offer a consent agreement at this time without possibly having a formal hearing now. So that was the reason behind my motion. But yes, that's the motion, is to request her presence at the next meeting, and until then, hope that she continues to comply, because every time between now and then, it's just another black mark.
Is there a way potentially, and this may be for Brad and Michael, is there a way to offer a consent agreement, but at the same time, we could make her appear before the next board meeting either way? Obviously, if she doesn't accept the agreement, it would be a formal hearing, but is there a way to offer a consent agreement or extend a new consent agreement that has extension in it for another violation, and then for us to make her aware of the seriousness of not calling in or missing a blood test? Can we do a consent agreement without seeing her, without, I mean, she's either going to accept it or not, so.
Yeah, you can do a consent agreement without a formal hearing and without her coming before the board. I think the important thing to communicate to her is that, there's a strong incentive for her to show up whenever you ask her to, because for this very conversation you're having right now, you're trying to consider what is the next disciplinary step for not complying with the consent order. Or at me, that would be a great incentive to show up. Now, in terms of whether to send out the consent order first and then ask her to show up, or to have her show up, get some more information, see if there's, I don't know, just see what she says, and then offer it to her maybe at the board meeting, after the board meeting. That's just a matter of preference that I'll defer to the board on, whatever y'all think is appropriate.
I guess my big concern is what happens between now and her appearance at the next board meeting.
Mm-hmm.
And I guess if maybe we ask her for an appearance at the board meeting and by then she's missed some more calls or she's missed a drug test, then of course we're calling her to appear. We're not really calling for a formal hearing.
Mm-hmm.
I guess at that point, there's really nothing we can do until we have a formal hearing. Is that correct? If she doesn't accept it, I mean, can you vote to suspend the license if she? I guess if she doesn't appear, we can vote to suspend her license for lack of appearance at the board meeting. Is that a possibility?
You could instruct us to draft an order notice of hearing for suspension. There's also a provision in the Administrative Procedures Act that allows for a summary suspension if there is sufficient evidence that there is an imminent danger to the public health and welfare. That's pretty rarely used. You'd have to have a very specific set of facts as to how allowing her to continue to have a license would allow for that. and it would be suspended only until a formal hearing. So there is that option. Probably need to see what all the facts are. Probably to take a deep dive into that if we decided to do that. But if she fails to show up, you can instruct us to issue an order notice of hearing on behalf of the board and get the process started, that same day.
I have a quick question. Could we do a special call meeting just specifically to talk to her so that we can do that more quickly? If the next board meeting months from now, could we do a meeting specifically, especially to meet with her?
Right, call of the chair, absolutely.
Just my opinion again. I think we're kicking the can down the road.
So we can't really suspend, we can't suspend her license today. We can either this is our options as I understand. We can't suspend her license today. We can either see her in June, request to see her in June, and if she appears, take care of business then. If she does not appear, then we call for a formal hearing, which at that time we still can't suspend her license until we have a formal hearing. Or number two, we do something like Kara has suggested, maybe have a sooner meeting than June with Dr. Drosky to discuss it and go from there. So that meeting again would be a Zoom meeting, correct, Kara?
I think at this point in time, I think so, yes.
Okay.
Or we could do a conference call. It doesn't have to be Zoom. We could do just a regular conference call.
Conference call. Okay. I'm all for meeting sooner than June. I agree with Dr. Turchi. His main concern, or one of the concerns, was it's 60 days or more between now and June. So I guess I will take my previous motion off the table and I make a motion that Kara arranged for a conference call with Dr. Drosky.
I would just suggest that we do it as a Zoom meeting, just so we can physically see her.
Okay.
Okay.
I'll second Dr. Parker's motion.
Okay. Dr. Turchi, you okay with a Zoom meeting instead of a, yeah, okay. So the motion is we arrange for a Zoom meeting with Dr. Drosky fairly soon, Kara, okay? And when I say fairly soon, I'm thinking in the next couple of weeks.
Yeah, okay.
Okay. If that's possible.
I think it is.
Okay, all right. So we have a motion to meet with Dr. Drosky on a Zoom meeting in the next within a couple of weeks or so, and Kara will inform us of that. Is there a second? I think Dr. Turchi already seconded it.
Yeah.
Is there any further discussion? All those in favor of the motion say aye.
Aye.
Aye. Any opposed?
I oppose it just because I think we're kicking it down the road.
Okay. Dr. Underwood, did you vote?
I lost connection. I live out in the country, and I just got back on.
Okay, we have a motion concerning Dr. Drosky. Instead of waiting until June to visit with her at the next meeting, to hold another shortened Zoom meeting with her in about 2 weeks.
Okay.
And that is to discuss her deficiencies in the existing consent agreement.
Yes, I agree with that.
Okay, so would your vote is yes on the motion?
Yes.
Okay, we have 3 votes yes on the motion. Motion carries. Okay. And my place is just as noisy as everyone else's, but I would remind everybody that we have a mute button that you might be able to use if there's a lot of background noise. So moving on, Kara.
Yeah.
Okay.
Okay. Okay. So the next update I've got is Dr. Carol Rowan. And if you remember, her consent agreement has been for record keeping, and that was based on some disciplinary action that she'd had in another state. So she did complete the medical records CE. I got that information on March 8th. And then she has submitted her first set of records. So she has to submit 3 records per month for 6 months after her completion of this record keeping CE. So I have got records. So if anybody would like to volunteer to be the one to review those, I can send those to you, and then we can have an update on progress on her records at the next meeting.
I'll review them.
Okay. I'll send them to you.
Thank you, Dr. Underwood.
Okay, and then the last case update I've got, it is for a consent agreement that came out of the February board meeting. It was docket number 2019-20. I do not have that accepted consent agreement back yet. The respondent actually sent some additional information to see if the complaint committee would consider that additional information. And so I'm in receipt of that. We as a group have not reviewed it yet. So that's where we are on that. And that's all the updates I've got.
Okay. Well, then I guess that moves us on to our existing complaint committee report. And I believe, Kara, would you like to start us off, or Dr. Turchi with the first one?
Sure. I would, Dr. Turchi, if you want to take this
Sure.
first one, I'll let you do that.
This is docket 2919-19. And it is were 4 allegations made, and the first allegation was incompetence, gross negligence, or other malpractice in the practice of veterinary medicine. Second allegation, cruelty to animals. Third allegation was overtreating patients or charging for services which did not occur. And the fourth, allegation was failing to furnish details of a patient's medical records to another veterinary hospital or clinic, owner's agent upon request or waiver by the owner's agent. Also, unprofessional conduct was alleged on number E, to violate any law or regulation of either the state of Arkansas or the United States relating to prescription drugs or controlled substances. For a veterinarian, F, for a veterinarian to undertake the care of an animal and thereafter fail to render the care as generally accepted by the veterinary profession. L, being guilty of or dishonorable or unethical conduct likely to deceive, defraud, or harm the public. And O, conduct reflecting unfavorably upon the profession of veterinary medicine. So I'll briefly read through the complaint summary. On November 10th, 2019, the complainant presented her 3-year-old, 4.5-pound Chihuahua to the respondent for non-stop seizures that had started earlier that morning. The dog had a history of seizures and had previously been diagnosed with a portosystemic shunt and hydrocephaly by another veterinarian. The dog was currently on Keppra and neomycin. The complainant stated that she thought the dog had been started on phenobarbital on January 16th of 2019, but was unsure if the phenobarbital levels had ever been checked. On physical examination, the dog was non-ambulatory and unresponsive due to ongoing seizures. The respondent took the dog to the ICU treatment room and administered a dose of midazolam slowly to effect control the seizures. The respondent gave the complainant a guarded prognosis and recommended hospitalization for seizure warning. A treatment plan and cost estimate with a range of $635 to $1,031 was prepared and presented to the complainant. The complainant questioned the recommended treatments and requested that IV fluid therapy be given since it had been effective in treating a seizure episode in the past and she did not want to hospitalize the dog. The complainant stated that she wanted to call her other veterinarian and was left in the exam room to make the phone call. After some time, complainant left the exam room and went into the treatment ICU area. The complainant stated that she was going to let the respondent know that she would agree to the estimate, but instead, there was a confrontation between the respondent and other staff. The complainant was instructed to return to the exam room, and she demanded that the patient be handed over to her. The dog was handed over, and the complainant was asked to leave, or the police would be called. The complainant left without paying for the exam test. The complainant immediately drove the patient to another emergency clinic. Upon arrival, a physical exam was performed and oxygen therapy was initiated due to a pulse ox of 66%. The complainant was presented with a $1,400 estimate, and she consented to diagnostics and treatment. A CBC, chem panel, blood gas, and urinalysis were performed, and the veterinarian reviewed the lab results and expressed concerns about renal failure and a possible Addisonian's crisis. He recommended an internal medicine consult, but the owner elected humane euthanasia. A necropsy was not performed on the patient. On November the 11th, 2019, the complainant called another veterinarian who requested a copy of the medical records from the respondent. The respondent informed the consulting veterinarian that there were no records. Complainant asked her attorney to request a copy of the medical records from the respondent. A letter from the attorney requesting the release of the medical records was mailed to the respondent on 11/15 of 2019. Complainant never received the medical records from the respondent, and the complainant ultimately received a copy of the medical records from the board office. So she never received the records directly, but after they were received by the board office as a result of the complaint, they were forwarded to the complainant. So the recommendations of the complaint committee is to dismiss the complaint for the following reasons. There's a lack of evidence to prove that the respondent violated the Practice Act regarding the alleged allegations about the complaint. The complainant was provided with a cost estimate, which she was allowed time to review because she was unsure about agreeing to some of the items in the estimate, like the hospitalization. In this situation, hospitalization was a reasonable requirement due to the severity of the patient's condition and the need to be monitored. The complaint committee does recognize that there was an issue with the medical records not being given to the complainant upon request, because ultimately, complainant received the records from the board. Therefore, the complaint committee recommends that a letter of advisement be sent to the respondent as well as the clinic, due to it being a multi-doctor practice, explaining that medical records must be released upon request. So that's our report and our recommendation.
I make a motion, we accept the complaint committee's recommendation.
Okay, there's a motion. Is there a second?
I'll second.
Okay. There's been a motion and a second, so let's, if we need some discussion, let's have some discussion. So I assume, Dr. Turchi, that this is the first place that this patient was taken on November 10th was an emergency clinic also, correct?
That's correct.
Okay. And so the pet had already a pre-existing history of seizures, and it was on the drug and maybe a portosystemic shunt or liver shunt, and that's why it was on Keppra and neomycin. And but we don't have records of that from the previous, where that was previously diagnosed at, correct?
There were some records from the previous clinic. Yeah, let me look back at those right quick. Let me look through here. Take me just a minute to find those, but
Well, I mean, we do have them. Is that, and
there are some records from the previous diagnostic workup at another clinic.
Okay.
So there was documentation that the portal systemic shunt was diagnosed.
Okay.
Yeah, in that record, they show where there was on lactulose neomycin for suspected liver shunt. Yeah, so there was, they had apparently run post bile acids at the previous clinic to diagnose that condition.
And besides the Keppra, was there phenobarbital also recommended or no?
That's
Yes.
what I'm looking through now. Let me look through the records right quick. Yeah, I'm looking in those records and I don't see. Yeah, I
That's
don't
okay.
see in those records. Let's see, now it says on a previous, in December of 2018, was when the previous clinic had seen this dog and made, the diagnosis was made earlier that month, it looks like, because the blood draw was on 12/7 of 18 and on 12/27, so 3 weeks later, there was a seizure episode. And at that time, there is a record of treatment with phenobarbital in the record. But I see no indication in the record that phenobarbital was ever dispensed. Now, and there are indications of seizures on 12/28 and also 4/17. But there's not a lot of records on what treatment was given at that time, at least on the ones I've got. Let me.
Okay.
These
Do
were
you have
handwritten. Some of them are hard to read. So.
Yeah.
Dr. Turchi, Dr. Parker, I apologize. I should have led the meeting off with this statement. I just wanted to reiterate for anyone that's dialed in that is not a counsel for the board or a board member, this is a public meeting and you are able to watch the proceedings, but you are unable to participate. There may be a time for public comment at the end, but for right now, the discussion should be limited to the board members.
Okay.
Dr. Turchi, so there was an estimate of a cost estimate from the initial emergency clinic, and do you have the items that are on that estimate?
Yes, we have a copy of that from the initial estimate. Let me look it up here. Their initial estimate was for an emergency exam, CBC comprehensive panel and electrolyte workup, catheterization, hospitalization, estimate for fluid therapy administration and maintenance, and an estimate for seizure medication. And their estimate was a range from $635 to $1,031 on that estimate. But that is a printed out estimate that we have.
Okay. It also said in the synopsis of the case that the owner questioned the recommended treatments. Like in what way did she relay to us that she was questioning those treatments?
Well, in the past, I guess there was a seizure episode in the past where this dog had been treated with IV fluids and just seizure medication. And so at this time, what I gathered from the complaint was that she wanted just to try the IV fluid therapy alone. There was no mention of seizure medication in there. So it was my assumption that she was assuming that IV fluid therapy alone, if they would just give the dog some IV therapy and hydrate him and send him home, that it would be okay. That was what I gathered from the complainant's synopsis of the case. And it was the veterinarian's, the first emergency clinic, the respondent's opinion that alone, IV fluids of therapy alone, was not going to stop what was going on. Now, they had controlled the seizures with the initial dose of seizure medication, midazolam, but you know, they were requesting seizure monitoring because they had controlled them with a single dose. The question was, when that wore off, was the seizures going to be controlled, or was the dog going to start to seizure again? So,
Okay. So we got a recommendation from the first clinic on what they recommended at their hospital. And then the complainant was given time and wanted to call her veterinarian, and I guess did. And then after that, she left the exam room and showed up in the ICU treatment area in a confrontation. So it must have been a pretty bad confrontation, sounds like, if the police were possibly in the back of somebody's mind as they called. What was the confrontation over?
according to the both sides, she went back to get her dog, and then apparently she was in a restricted area because they're not allowed in the back. And when they asked her to go back to the exam room, then I guess that's when the confrontation started. And then she requested, after a back and forth, I guess she requested to take her dog, which they released the dog to her. And then she left the clinic without, without paying. Now, I will say this: there was some surveillance video requested by the complainant of, and the clinic did send the some clips of the video, surveillance video, to the board, and we reviewed that. There's not a clip of that confrontation. There's a clip of them treating the dog in the ICU room. You can see that they bring the dog back, they administer medication, they do an exam on the dog. And there is a clip of where the client is leaving the building with the dog. But apparently there was not a camera on the door where the client came into the exam room to show that confrontation. But on the rest of the videos we watched that they sent us, there didn't it appeared to me that they were doing the right thing as far as stabilizing the dog, and they did. From what I could see in the video, they did an exam on the dog. You can see the veterinarian administered medication, and then they're just kind of, the dog is maintained on the table until the client can make a decision on what, I'm assuming, on what route of treatment she wants to take, and to assign the consent to go ahead with treatment. So
those records that we have from the initial exam to when the client took her pet somewhere else, do those seem like they're in order, Dr. Turchi?
Yeah, there's physical exam findings. There's basic physical exam findings. Under the neurologic findings, it's just seizuring, but there is a complete general, they went through all the systems, and all those are documented in the records. And there is a history, when they took the history, there's the history. The main complaint problem is seizuring, and the puppy had been seizuring this morning and acting painful. And it went through all of the medications and the conditions that were there. So yeah, there is documentation that the seizure medication was administered too. We have that in the record and in the control logs also, control substance logs also. So.
And so the little dog ended up at another emergency clinic, and sounds like from the medical recommendations at that clinic, kind of going down the same pathway of diagnostics and recommended treatment would be somewhat similar. Is that what you see, Dr. Turchi?
Yeah, they pretty much recommended a full workup, which included some of the same blood work that was on the original recommendation from the complainant. And I guess after looking at the veterinarian at the second clinic, after looking at the blood work, was concerned about renal failure. Obviously, pulse ox of 66 is a problem, but if this dog had been seasoned for a while and they'd been controlled, there was a time lapse between obviously taking the dog from the first clinic to the second clinic, so there probably was no oxygen therapy or anything over that. So I guess the veterinarian at the second clinic was concerned about renal failure and an Addisonian's crisis, and he recommended that there be a maybe an internal medicine consult, and at that point, the complainant decided just for humane euthanasia at that point. So.
And, okay. And, Kara, our complaint forms that we give to the public when they want to file a complaint, it says on there, if I'm not mistaken, that they should pick out one statute and one rule that they think there's a problem with. Is that right?
Yeah, we do have on the form to pick the option that best fits the situation. Of course, I mean, there have been other instances in where I have folks pick more than one. And, you know, sometimes they pick something and the complaint committee may find that there may not be a violation for that, but, you know, may find something in the that's different. So, but yes, to answer your question, you know, we do ask just for one option to be chosen.
Okay. All right. Dr. Underwood, do you have any other anything at all?
No, it sounds to me like that I agree with the complaint.
Okay. Dr. Bird?
I agree.
Okay. I think it's very unfortunate that the little dog had seizures. It had previous history of some medical problems, some of them very severe, portal systemic shunt and hydrocephaly. I really regret that the little dog had uncontrolled seizures on that day. This is just my take on it. I think that the doctor, the initial doctor, helped to control the seizures. The owner was given a medical recommendation and an estimate of the costs. For some reason, she was in question of that and chose maybe no. But before treatment was began, there was some kind of altercation that led to both parties saying, I'm done at this point. I'm not having my pet treated here, and the physician there going, that's fine. If you choose not to have it treated here, then that's fine. So up until that point, after that point, the relationship is over. My review of the medical records, my thought up until that point, appropriate actions were taken. It was the decision of both parties at that time after the confrontation that the relationship was severed. I think with the relationship being severed, I don't see that there's support for any of these violations on the complaint request. I think that both parties probably got angry, maybe had their feelings hurt, maybe there was other words said we're not aware of, but if we review the medical records, and that's what we're left with, is looking at what's in the medical record, responding to the complaint form, responding to the respondent's form, filtering out that testimony by hand and seeing what they say. I just don't see that there's been a violation of the Practice Act. I do think that it would have been a better idea on behalf of the clinic, the initial emergency clinic, to put together some records and forward them to the client on proper request. But that's about the only thing that I see that I would have recommended that they improve upon or have done differently. The rest of it on the initial workup, I think, was properly done. So I'm going to agree with the recommendation that there's not evidence to support the allegations against the respondent. I do agree that there needs to be some contact with the clinic to say that we expect medical records to be released upon proper request. And again, since it's a multi-doctor practice, I think it needs to go to all of them, you know, to the respondent and the clinic. So we have a motion and a second. I'm going to ask one more time, is there any further discussion by the board members? Okay, all those in favor of the motion, say aye. Aye. Dr. Turchi, you don't vote. Okay, so all the members have voted yes, and the motion carries.
Dr. Parker, at the
Yes.
end of the previous discussion where we had a motion on the floor, I lost connection, and when I dialed back in, I didn't hear what the results of that were.
Are you talking about with Dr. Drosky?
Yes.
Okay, the results of that were that we had voted to have a Zoom conference with Dr. Drosky, and Kara's going to arrange for that in the next 2 weeks.
Okay.
Does that answer your question, Dr. Bird?
Yes, sir. I'm back up to speed.
Okay. All right, well then, let's move on to the next case on the complaint committee.
Okay, so,
You want me to read this one or?
sure.
Okay. Okay, this is docket number 2019-22. The allegation is 17-101-305A5, which is competence of negligence of veterinary medicine. So the summary is on March 22nd, 2019, complainant presented a 3-year-old male American bulldog to a respondent for surgical neuter, pedicure, and dental. Complainant was instructed to return at 4 p.m. to pick up the patient. Respondent noted that the physical exam findings were normal, and complainant declined. There was no surgical consent form or physical exam findings in the medical record. The neuter dental procedure was performed under general anesthesia with 1.5 milliliters RKIB induction, intubation, and maintenance on servoflurane gas anesthesia. The castration was performed with double ligation of the spermatic cords, with the visceral and the skin and SQ tissue was closed with 3/0 visceral. Vet board glue was used externally on the incision. The teeth were graded as stage 1 mild tartar, scaled, and polished. Respondent administered 4 ml B-Pen SQ and 0.78 milliliters Ketofen SQ. The patient was placed on a blanket and heating pad and monitored during recovery. Respondent left the clinic to go on a country call and left the patient to recover under the supervision of Dr. B. According to Dr. B, the patient was slow to recover from anesthesia, weak and knuckled on the left hind limb. Vital signs were checked. Respiration rate 30, heart rate 120, temperature 100.1, MN pink and moist, CRT less than 2 seconds. Ultrasound confirmed the presence of free fluid in the ventral abdomen, and 1.5 ml of blood was aspirated from the abdomen by respondent. CBC was in with normal limits, no anemia or thrombocytopenia. A 4DX test was negative for tick disease and heartworm disease. A blood smear revealed adequate platelets. Respondent returned from the country call and made the decision that the patient was not losing enough blood to warrant another surgery. Complainant arrived at 4 p.m. to pick up the patient and was informed by Dr. B of the post-op condition of the patient and recommended overnight observation and IV fluids. Since vital signs were normal, Dr. B did not see the need for exploratory abdominal surgery. The patient was started on IV fluids and a vitamin K injection was administered. The medical record did not list the dosage of vitamin K or the volume infusion rate of the IV fluids. Dr. C checked on the patient at 6:30 p.m. and 9:30 p.m. and noted that he was alert, responsive, and receiving IV fluids. Let's see. I think I have my numbers backwards here, but on 3/23/19, the patient was found dead in the kennel by staff. Complainant was informed of the patient's death at 8:30 a.m. and Dr. C was granted verbal permission to perform a necropsy. Necropsy findings included no evidence of external hemorrhage. The right testicular cord and vessels were ligated and intact. The left testicular cord and vessels had slipped through the ligature and into the abdomen. The blood clots were found in the abdomen. Dr. C contacted complainant at 3:30 p.m. and informed him of the necropsy findings. Complainant was upset because no one communicated updates overnight, and they received no answer to who was responsible for the overnight monitoring of the patient. So the recommendation of the complaint committee was, although complaint committee did not find evidence to prove respondent's allegations, it did find deficiencies in the medical records due to no surgical consent forms or physical examination findings. It is the recommendation of the complaint committee to offer respondent a consent agreement for the record keeping issues. The terms of the consent agreement would be: respondent must obtain 4 hours of continuing education in record keeping, in addition to the 20 hours of continuing education required for a license renewal. Respondent would have 6 months from acceptance of the consent agreement to complete the CE and record keeping. Respondent must submit records of 3 surgical or medical cases per month for 6 months following the completion of the CE and record keeping. The complaint committee also recognizes that this is a multi-doctor practice and that several doctors were involved in this case. Therefore, the complaint committee would like to send a letter of advisement to the clinic regarding the medical record deficiencies and how that relates to the practice as a whole. There's a summary of the at this point, if you have any questions or have discussion.
I'm curious, has anyone had a problem with bleeding into the abdomen from a castration?
Yeah, I had one last week in a horse.
Dr. Underwood?
No, I've not ever had that problem. I could see where it could happen, but
I've never had one that I know of, not on a castration. I've had them on spays when I'm already in the abdomen, but I hadn't had them on castrations.
That's been my experience.
In the medical record, Dr. Turchi said there was no consent form and no physical exam findings. Was there a surgical report? Anything about a surgical report, or are we just going on the respondent's statement?
There was a little bit, most of the records were handwritten, and essentially about what I've summarized. My summary is almost word for word some of what the report, the record showed. I mean, there wasn't a lot of, like I said later on, there wasn't a volume of fluids recorded, how much was given, what the flow weight was. There wasn't a dosage of vitamin K, and even on those drug dosages that were initially given for induction, they just give us mLs. They don't give us any kind of milligrams, what the dosage was on those either. And there was just that brief description on the surgery. So there wasn't any kind of like a pre-surgery exam that I could see where, you know, TPR, all those things, mucous membranes, all those things were recorded. There was definitely not a consent form. They did say that they did deny the pre-surgical blood work, but since there wasn't a surgical consent form, there was not a form to document whether that was actually accepted or declined. So.
Was there any indication, Dr. Turchi, that this was a client that had been seen before, or this was a presentation for the first time?
Well,
Contact this.
on the records that we were sent, there were records from back in October for vaccinations, it looks like. So it looks like the dog had been seen, at least because there were reminders on those dates for vaccinations. But that was pretty much all the record that was sent to us. I don't know if they'd done anything else. He'd also had, it looks like the main thing that I see on the records that were sent was there were vaccinations given, or reminders for vaccinations. So at some point they had vaccinations. In the record, it looks like here, back in October of, the records go back to 17, showing some hospitalization. Doesn't say for what. Maybe it was in pedicure and just routine vaccinations, but there was nothing else prior to that other than routine stuff, it looks like.
That's neat.
As part of the record, what was submitted was a brief handwritten records, but then there was a summary of the incident that was submitted as, it looks like part of the record, and it's signed by the respondent, but there's no date on it. So it's like a handwritten synopsis of what happened that was put in the record. But once again, there were no accurate dosages of any drugs or anything. Just kind of
What's the exact wording on the necropsy report? Do we have that?
Yes. Just let's see right here. Yeah, I'll just kind of briefly read through it. It may take me a little while because I'll have to redact some of the things out of it. It says, on Saturday morning, I spoke with the complainant for a necropsy of a pet that is deceased when I arrived at the clinic Saturday morning. The pet was found deceased by the kennel staff. The pet had a neuter procedure performed the day before. There was no evidence of external hemorrhage. Upon entering the abdomen, blood clots were found in the abdomen. Incisions were made above the inguinal canal. The testicular cord and vessels on the right side were ligated and still intact. The vessels on the left side had slipped through the ligature and into the abdomen and began hemorrhaging within the abdomen. I spoke with the doctors on duty on Friday and learned that the recovery following the neuter had been slow. A complete blood count was performed as well as abdominal ultrasound. Excuse me. The pet was then placed on IV fluids using lateral saphenous catheter placement. Excuse me. I checked the pet at 6:30 and the pet was alert, responsive, and receiving IV fluids. Checked the pet again at 9:30. The pet was still receiving fluids and was responsive and alert. Sometime between 9:30 p.m. and when the kennel staff arrived, the pet had died. I contacted the complainant at approximately 3:30 p.m. and informed him of the necropsy findings and relayed cause of death. So that was the report on the necropsy findings. So this was Dr. C, which was the third doctor involved. And as you can see from that, he was unaware of what had been done even the day before, I guess. He sounds like he was there that evening and was checking in on the dog as he was receiving IV fluid therapy. But it looks to me like, and I don't know because this isn't in the record, looks to me like there was nobody in attendance overnight. So I don't know whether the dog was left hooked up on IV fluids or they ran fluids until whenever this doctor left and then they disconnected him and then came in the next morning and he was dead. There's no record of any of that. So, but there definitely looks like there was someone there overnight, and I guess that's one of the problems that the complainant has with the respondent is that they were under the impression that the dog was going to be monitored overnight, and it does not look like it was, according to the record. So.
I think that it's pretty common can be pretty common practice that pets stay in the hospital overnight and be seen late in the evening, be seen again early in the morning, and there not be someone there 24 hours a day. I do think that happens. It happens a lot. It happens at my practice. If the owner is comfortable with that, if they're not comfortable with that, then it depends on where the practice is located and how far it is to an overnight facility, and if the owner is willing to, transport to an overnight facility. So as far as nobody being there overnight, I think that's a common practice. If there's, understanding of that from all parties involved, or do they need someone there all the time? So it's my understanding also that the initial doctor who did the surgery went on a country call, came back. That person's the one who aspirated the 1.5 mils of blood from the abdomen. Is that correct, Dr. Berkey? Okay.
Yeah, apparently there was another doctor monitoring the patient during recovery while the initial doctor was gone.
Mm-hmm.
So that's where you got 3 doctors involved, and the second doctor that was monitoring has also some handwritten notes. And she's the one that informed the owner when he arrived to get the dog that the dog had some issues with recovery, and that they were a little concerned that there may be some bleeding. And that I think she's the one that actually ran the CDC, the diagnostic test, 4DX test, the heartworm, and the blood smear. And so it looks to me like the second doctor was the one that relayed the information to the complainant when they arrived at the dog, and also recommended the dog overnight on IV fluids. It doesn't say in the record that they ever stated that there would be somebody observing the dog all night, but the record just says, I recommend keeping overnight on IV fluids. Now, maybe it was the complainant's understanding that there would be somebody there all night, but it doesn't really show in the record that statement was made.
Also, so the initial doctor who did the surgery, that person's medical recommendation is that there was not enough bleeding to warrant a second surgery, correct?
Correct, that's correct.
And then Dr. B stated that based on the blood work being normal, they did not recommend an additional surgery, correct?
Correct.
All right, so there's 2 doctors there that have their eyes on the dog, and they're aware of some internal bleeding, but both of them are medical opinion is the dog doesn't need a second surgery.
Right.
Correct? All right. What'd you do with your horse that had abdominal bleeding? I know
Well, on those
different thing. I understand.
Yeah, but on those, you're not going to go in and look for a bleeder because most of the time they're retracted. What I generally do is close the scrotal incisions to prevent external loss of blood, and it's more than likely it'll clot under pressure. But this horse actually, he showed signs of going into hypovolemic shock, so I put him on IV fluids and ran a volume of IV fluids to him, and kept him out of pain. And it took me about 5 hours to get him stable. But once I got him stable, he was fine. So yeah. But on those, it's just fluid therapy. One of the questions is we don't know what volume was given and at what rate. So, did they run enough fluids? I don't know. I'm not a small animal, but for us, when we get bleeding like that, we don't go in looking for bleeders, obviously, because that's a major ordeal in large animals versus, small animals you can put on a table maybe and go back in and look. I mean, abdominal surgery is abdominal surgery. It's still a major surgery, but fluid therapy. Now, I don't know that I've ever had a case that I lost from internal bleeding. I've had several that had massive external bleeding, have gone into shock, and we packed the wounds, sutured them under pressure, and put them on IV fluids. And most of those we've actually stabilized and saved. So it's just got to be pretty aggressive on the front end to save some of those. You know, if you're not aggressive enough with fluid therapy, those things can go into hypovolemic shock. At least on the large animal side of it, I will say that. So,
Hey, Dr. Underwood, based on your experience in the small animal world, what's your, we have two doctors here that had the patient with them and saw the patient, observed the patient, ultrasounded, and all the other things that went along with it. You said you've never had a castration with blood in the abdomen, correct?
No, never a castration. I've had spays, but I've never had a castration.
Yeah. So what do you think about that?
Well, I'm a blood phobic. If I had a castration and I took blood out of the abdomen, I'd have opened that baby back up.
Mm-hmm.
That's me.
Dr. Bird, what do you think?
I've never had one like this. And even on spays where there were bleeding on an otherwise healthy dog, I've never seen a problem. Never had one die like that. I'll put it that way. And so it appears to me that they did everything that could be expected. We obviously don't know what happened after 9:30, but the fact that the dog was checked on after hours, even though it wasn't continuously all night long.
How long you been in practice, Dr. Bird?
1978.
You ever have a spay bleed?
I've never had, I've had a spay bleed, but I've never had one die as a result of it.
Did you ever go back in on one after it was bleeding or not?
No. What I was taught is that if you go back in on those, the likelihood is you're going to create more problems. And that's been my experience over the years. Unless there's some reason to believe something else is going on in addition to what happened, but on an otherwise healthy animal, I wouldn't have done anything beyond what's described here.
So you're trained. Go ahead.
I will say that, you know, to me on bleeders like this, a CBC, the only thing I can gather from the CBC is a platelet count that means anything to me, because when you're losing blood, you're losing blood volume, and that's blood, plasma, protein, everything. So if you run a blood count, a CBC, unless there was a pre-existing platelet problem or anemia, you're not going to know that, because to me, the only way you know, at least on the cases I've done, to know where we stand is to get those animals back hydrated and then run a packed cell volume on them. I guarantee you, if you took that dog and run a packed cell volume on him before you did surgery and run a packed cell volume on him again after he started to bleed, his packed cell volume was probably going to be the same, because he's losing whole blood into his abdomen. Now, once you get him hydrated and you run a packed cell volume on him, you're going to have a, because you're going to expand his volume and there's not enough, it's going to look anemic. But if he wasn't anemic, you know, blood work prior to surgery did not show anemic or thrombocytopenic, I don't know that you had a problem there. But they supposedly declined pre-surgical blood work. So, you know, I don't do pre-surgical blood work on large animals, unless I think there's a problem. But I know in small animal, it's a pretty regular occurrence to offer it. Now, a lot of people decline it, but I do know there's situations in small animals where that maybe aren't apparent before surgery that maybe you need to know before you go in, and the client needs to be made aware of. So, but there wasn't any pre-surgical blood work. So, but it does appear that he was not thrombocytopenic, and they even did a blood smear, and according to their opinion, the thrombocytes appear to be adequate. So,
what was the indication for the vitamin K?
I guess it's, the only thing I can figure is to just cover themselves if there had been some kind, since they didn't run a clotting profile, maybe vitamin K as a prophylactic treatment against some kind of clotting profile deficiency or something, but there wasn't anything like that run, so we don't really know that.
Well, it says the CBC was in normal limits, no anemia, no thrombocytopenia, and with no history of exposure, to some hemolytic agent. I don't know. That to me seemed a little unusual, but.
I do know that, unlike you, Dr. Bird, if you take an animal's bleeding excessively and his abdomen's full of blood, then you've got external blood loss. So, yeah, you may find the bleeder and tie it off, but then you still have to replace fluid volume. And the question is, at that point, are you going to have to transfuse him also if he's lost enough blood? So, for that reason, in large animals, I don't open the abdomen. I try to keep the abdomen closed if at all possible to diminish external blood loss. So, but I know small animals different. You can actually go in and the other question is, we don't have the record of this, but maybe the recommendation at 4 o'clock when they showed up to pick the dog up was, if you'd like to have him monitored overnight, take him to the surgery referral clinic. I do know that there's a surgical referral clinic probably within 20, 25 miles of this complainant's office or the respondent's office. So that would have been an option. So.
Well, so Dr. Bird, you're saying that when you were trained early on, the recommendation was not go back in necessarily for causing more bleeding. It was medical management, correct?
Yeah, I watched a resident while I was at LSU that did, and it just seemed like it compounded the problem. And the head surgeon said that that's usually not a good idea in an otherwise healthy animal. The odds of finding the bleeder at that point is going to be, you're talking about a major abdominal surgery, and you're going to lose more blood in that process. Usually on a vessel that's been severed, the guy, from the way I'm reading this record, double ligated it, and the ligatures somehow slipped off, and it retracted into the abdomen. I've had some that have bled and filled the sac, the testicular sac, but I've never seen one go back into the abdomen. And I'm trying to picture how that could happen. I can't even imagine that, because usually if it's been crushed enough with a hemostat and then ligated, there would be a clot formed even if the ligature slipped off. I can't I think, I mean, I see why they would do the vitamin K and that kind of stuff, because this is extremely unusual in my experience. I mean, the only thing that they could have done, you know, was to wrap it with Vetflex or something and kind of constricted the abdomen somewhat to decrease the amount that can go, that can bleed internally. But this was not an abdominal surgery to begin with, you know, so unless there was, and there's no indication that something was wrong with the spleen. They did do the 4DX, but, you know, that's not foolproof for every parasite that's out there, and it only catches them at a certain point. So this dog could have had a pre-existing parasite problem that prevented it, but it would be, the odds against that are so high. I can't imagine that I would have done anything different in this case. And the fact that they were able to monitor, you know, and have the other vet step in when he was out on a call, seemed like pretty good coordination to me. And to have the other doctor see, who was double checking on it, you know, that evening, I can imagine the shock that must have gone over all of them when they discovered it dead in the morning. You know, what in the world?
Well, I don't know if you remember, but probably about 6 months ago, we had another case like this, and it was a case where a dog was left for a neuter and was neutered and left overnight. And the respondent had checked on the dog about 9:30, and he was in the kennel and, you know, looked at him, wagged his tail, seemed to be in good shape. He walks in the next morning, and that dog's dead. And he actually took that dog to Arkansas Livestock Poultry and had a post-mortem done on him. That was the one where the post-mortem kind of got delayed, but essentially abdominal bleeding. There was no apparent prior indication that there was a problem until they walked in the next morning and found the dog dead. So obviously at some point that ligature slipped off in that dog and he bled internally. So that's the only other case that I can think of in the past where we've had anything like that. But there was no indication apparently in that case. There was no indication that they had a problem, and the dog was doing good on the last check of the evening, and then they walked in kind of like this and found the dog dead the next morning. So,
I guess my thoughts is that, you know, as far as my experience goes, I've never had a neuter bleed internally into the abdomen. I've had them bleed into the scrotal area from a skin bleeder, something like that. I've even had to go back later and take out some big, massive blood clots out of the scrotum on these dogs and resuture it. Sometimes I would find a skin bleeder, sometimes I wouldn't. But as far as having an abdominal bleeder from a canine neuter, I have not. And now I've had, in 30 years, 3 or 4 cases of where I've either spayed or one of my colleagues has spayed a female canine, and there's been indication of abdominal bleeding. And I can say probably on half of those I've gone in and I've found a source of the bleeding. Sometimes I've gone in and I can say I probably have not found a source of the bleeding. Then you get into all those management things like Dr. Turchi was saying, with possibly needing more blood, not needing more blood, and did you really do the right thing or did you not do the right thing for the pet? But I do agree with Dr. Underwood. I'm kind of blood phobic. If I saw blood in the abdomen, my personal thoughts is, me personally, I want to think that I would have, you know, opened the dog up. Although our examination today is not the same as the eyes of the doctors on the pet on that day. And so to say on hindsight it was done improperly, I don't know that I can say that it was done improperly. I think that we've kind of got a division or difference of opinion on the board here, a split, not a true decision in one way or the other as far as what we would done, what we think should have been done. It's hard to say without being right there and having the pet in front of us and seeing the amount of blood. I guess my thoughts is to go with the recommendation from the complaint committee, but I would like to potentially, you've got 3 points down there under recommendations. Somewhere in there, I would say that the board was, I don't know if the word not in complete agreement or just divided on, no, the board was concerned. And you know, it's kind of my thoughts that I'm not going to make I don't think it's incompetence, gross negligence, and malpractice. I think if there had been no ligatures in there, then it would have been, you know, that incompetence. But there were ligatures, but it's the question of whether the pet should have been opened up or not. We're talking about a 78-pound dog, probably based on the ketone dosage. We're talking about a male dog with a prefuse in the way where you'd have to open him back up. We're talking about a bulldog who's probably a fat bulldog in the abdomen. So the abdominal surgery in that type of patient would not be a cakewalk. It would be, could be very, very difficult. But I guess my concern is that there are some clinicians out there that this could be borderline on failure to care afterwards. I guess maybe we shouldn't add anything, but my concerns is that it's borderline on whether the dog should have been opened up or not. So I guess I'll just leave it the way it is.
Well, my thought was either that or offer for referral for overnight, observation, at an emergency clinic where they knew somebody was going to be there overnight. That, and that wasn't offered, but, it just said IV fluid therapies and to keep him overnight. It didn't say he was going to be watched overnight. So at least in the statement of the medical record. So may have been some communication issues there because the client understood maybe that, well, we're going to keep him overnight means we're going to watch him overnight. Whereas the clinic keeping him overnight was we're going to treat him till, the last shift is over and then we'll, check on him in the morning. So, I try to make it real clear when cases in my clinic what's going to happen.
Yes.
If I say, if you bring me a colic and he's going to be on IV fluid therapy, then I'm going to watch him overnight. And am I going to be in the clinic overnight? No, but I've got an internet camera where I can watch him. And I may go to bed and I may wake up every hour and turn that on, or I may have to come over here in the middle of the night and add fluids to this therapy or something. But I make it, plain that that up front, if I, and there are cases where I've had 2 or 3 nights and I'm not going to do that. And my offer to the client at that point is that, you've got 2 choices: keep them here and I'll treat them the best I can, or you can take them to a referral center. And a lot of my clients say, no, you do what you can. And so but they're aware up front that's the way it's going to be. I'm going to hook them up. I'm going to monitor them on camera the best I can. I'm not going to be here all night, but if an incident arises and I can detect that on a video camera, then I'll be here to address it. So, especially in colic cases, because sometimes you have to come back in and do, pain meds or analgesics during the night if they start to get uncomfortable. So, but I think that's the deal. You got to communicate with clients and let them know exactly what's going to happen so they can make an informed decision on what they want to do.
All right, is there a motion?
Well, I'd like a little discussion on the recommendations. Is there any indication, did you look at any of the other records to see if this is fairly common practice for this clinic not to require a pre-existing
Here, I'll let you.
surgery?
Well, we don't have any evidence. We just have this one set of records for this particular clinic. But I will say that in the past, there have been some record issues at this particular clinic, which is a multi-man practice or a multi-person practice. And it was at one point in the past, the recommendation was made that they needed to upgrade their records. So we're kind of, now, is this an isolated case? I don't know that because we've not looked at any of their other surgery records. That's why one of our recommendations is, along with how we usually do them, is to send those cases so we can see what's being done. But I don't know if that's going to be a reflection on this one clinician probably will be under the consent agreement. And that's why, I think we need to, and I think in the recommendations, let's see, that we need to write a letter of advisement like we recommend to the clinic, direct to say that, hey, there were some issues with record keeping and we want to be sure this is not a clinic-wide problem, that it was maybe just an isolated case. But we don't know that without, having to requisition a bunch of additional records to look at them.
I've got a comment. I think that something needs to be in there. I mean, we don't know anything about the skill level of this clinician or whatever, but I think it's written on there that they must have their 4 hours. I think in their regular 20 hours of continuing. I think they need the basic surgery techniques and basic surgery monitoring, or basic, like monitor, but the surgery techniques, because it sounds to me like that the ligature just slipped off. And, did they tie it correctly, or is it just one of those fluke things where they slip off?
Yeah.
So does anyone want to amend the recommendations at this point from what does anybody have a formal thing that they want to amend the recommendations of the complaint committee or not?
Well, I guess my thought of the deal is requiring him to do 4 hours of continuing education and record keeping without the other doctors having to do something similar. They were all three involved in the thing. I don't know that it's going to correct anything.
Well, I think it'll go a long ways, I guess. I don't know if there's, didn't you tell me, Dr. Turchi, that they'd had some recommendation at this clinic sometime in the past to improve their records?
Mm-hmm.
Yeah, and did they comply with that recommendation?
I'm not sure because I don't know if it was a consent agreement or not. I think it was a recommendation. I think there maybe was a consent agreement against the respondent in the last. We'd have to look back at that. But I do know from memory that this clinic, it was an issue back then that was addressed to the clinic manager. And I can't remember how far back it was. It's been several years ago.
Kara, do you know, Kara?
It's probably been 5-6 years. I mean, it was when I first started, and I'd have to pull those records and see what exactly happen.
It wasn't a consent agreement, was it? I think it was just a recommendation, wasn't it?
I think like I said, I would be hesitant to say for sure exactly what we did. I know in that particular instance, the respondent for sure had a consent agreement in place. I do remember that. My feeling is that we sent the clinic a letter also, but I think it was a consent agreement.
And I will say that to my knowledge, the original the complaint 5 years ago, it's my knowledge that that clinician is no longer at that practice. So, you can, if you send a consent agreement to one practitioner, he may meet it and his records may get really good. But then if he leaves the clinic and the clinic hadn't changed anything, sometimes you take one guy to make the example for for everybody else. But if you don't change they need to be aware of that if you don't change your practice, ultimately it's going to catch up with you. It's hard to defend yourself against these allegations if you don't have records. So, it's kind of practice at your own risk. If that's the way you want to practice, at some point, it's probably going to catch up with you. And this is usually the type of case, as long as everything's going great, there's no issues. But it's the one case in 2 or 3 years that goes south on you, and you don't have everything documented on it, then it's going to cause you issues. So, I will say that I can tell you this: the respondent has been in practice for a number of years. So,
is the respondent the practice owner?
No.
Because I have found, just like doing these records, and then with my experience with people in and out of my clinic and all, is the person that either owns the practice or is the doctor, they're the one that set the tone for how the records are kept.
Yeah.
Because if
I would agree with that.
does sloppy records, then the rest of them are.
Yeah. And like you said, once the record keeping, once the lead guy sets the example, everybody pretty much falls into line, they feel like that's kind of the standard, and you just kind of, as long as you, I know when I was in practice years ago, I practiced for a guy for 6 years. He didn't, I don't know how we got away with it. He didn't keep medical records. X-rays all got thrown in one big box, that was filed separately. And the first thing I did when I went out on my own was like, this isn't happening again. So and I tried to keep records at that clinic, but there's no way of doing it when you don't have a system. But since I've gone out on my own, everything, sometimes I'm sitting at this desk later than I need to be finishing medical records every night. But
yes,
yeah, but that's all part of it. So.
I guess I'm going to make a motion. All right. I'm going to make a motion that we accept the consent agreement as written. But in addition to that, I'd like to amend it that we write a letter to the practice owner, reminding them that they've had some records. We've had concerns about their medical records in the past, and that if it's a multi-doctor practice and some of them are not owners, then the ones who are not owners follow the lead of the owners of the veterinary clinic, and we would impress upon them the need to set an example of record keeping for their employees. Otherwise, this is going to be a continual problem, and one of these days it's going to result in could potentially result in more severe violations for the owner or the doctors for lackness or slackness of record keeping.
I guess I would rather see the requirement. If you're going to ask the respondent to have CE and you're going to send a letter, of advisement to the rest of them, seems like there ought to be a requirement for the owner to have continuing education as well.
If I'm not mistaken, I don't believe the owner of the clinic was a respondent on this complaint. I would be uncomfortable sending a CA to him without the opportunity to respond to the board first.
It seems to me we're not addressing the problem. Just to deal with the one individual.
Well, with that being said, I guess I'll take my motion back and I'll just say, I'm going to move that we accept the motion the way it's been written by the complaint committee.
I'll second it.
If that's the motion, Dr. Underwood has seconded it. I finished my discussion, but is there any other discussion by any of the other board members? Okay, if there's no further discussion, all those in favor say aye. I will say aye. Dr. Underwood?
Aye.
Dr. Bird?
I'm reluctant on this.
Well, we got to have 3 votes to accept the motion, or we're going to end up having to have something like a formal hearing. So I'm a little uncomfortable with it too, but as far as the formal hearing coming out and being productive, I'm not so sure that it will be.
I'll say aye.
Okay. I guess the motion passes. I don't think that we're completely comfortable with it, but I think it passes. I don't know what else to say about it. Okay. What's the next item on the agenda, Kara?
Okay. I think we are ready to move on to rules at this point. And I have categorized them and sort of, oh, in a second, I think Michael lost us and I think he's traveled on. Okay, hopefully Michael should be able to join here in just a minute. So with the rules, I have summarized into categories the types of comments that were. So if you kind of want me to go through those, I can do that if you want me to.
Why don't you take us in whatever the best organized fashion to get through that is, okay?
Okay, well, we'll try it this way, how I've prepared my notes, and see if that works. So we received comments on 3 of the roles. If you remember, we actually had 7 that were out for public comment. The first role we received comments on was the role in continuing education. And we received really two main types of comments. The first one being, hold on just a second, let me get my. So we received 6 comments that were against adding the requirement for the controlled substances CE. And we received 1 comment that was against taking away the opportunity to have CE exhibit halls. And then after that, we did receive one positive comment about the fact that we're going to be allowing more hours. So I think really the ones we need to address, if we're going to, would be the controlled substance requirement and the exhibit hall issue.
Wasn't that basically because of statute?
On the controlled substance?
Yes.
Well, I think the idea behind adding that was to show that the board is being proactive in the midst of really the opioid crisis that's going on. Also, that veterinarians have to report to the PDMP. They have to check the PDMP. And I know the Department of Health has been offering education on the PDMP, like at the winter meeting, that sort of thing. But I think more than anything, it was so that, you know, the board was taking steps to just sort of highlight the importance of, you know, responsible, veterinarians being responsible for substances.
It, correct me if I'm wrong, but isn't that a requirement for medical doctors as well?
Now, I don't know for medical doctors in the state of Arkansas. My guess is that's probably true. My guess is that nursing board may have those same requirements, but I know several other boards of veterinary medicine in other states. I know Alabama, Oklahoma, there's probably others. They have this requirement. So this is not, you know, out of left field. There are other states that do have this requirement.
I will say this, since I'm licensed in Oklahoma, I can vouch for this. In Oklahoma, it's not a required CE credit. It's you have to sign off that says you reviewed the regulations, but there's no like CE. So you're essentially, when you sign that document, you're saying, I've done my 2 hours of controlled substance review. Now, what I usually have to do is I usually have to go to either the DEA website, or Oklahoma has a pharmacy website where you can go, and I usually just, I think I printed off the pharmacy website years ago, just go through there and review their read the regulations, or if there's any new updates, read them. But it's not actually in Oklahoma, it's not actually CE that you go and get that's race approved. It's actually, it's just you're signing off that I've reviewed them. And so maybe we need to do something like that. So 2 hours of review of, now, since it's kind of the honor system that you did that, but I can understand some of these guys saying, well, where am I going to get 2 hours of race approved CE on opioid or controlled substance deal? And that could be an, you know.
Yeah, I don't think there's a requirement that it has to be race approved, although we accept race approved meetings. You know, if the prescription drug monitoring program, if they're doing a presentation, you know, meeting, and someone attends that, you know, I think that, I know the AVMA has some webinar controlled substances, I think opioids in particular. But it doesn't have to be specific to opioids. It would just be, you know, controlled substances. So I think however they can get it, I think is fine. I don't think it has to be race approved.
Well, I will say this, I don't see that kind of course is offered at any of the meetings, whether I go to larger meetings in Kansas City or Texas or wherever. I don't see CE really on controlled drug substances. There's just not really classes there. There may be occasionally, I'm not saying it's never, but to try to find CE on that, I think number one will be difficult. Number two, I did read one of the public comments where they said it would be redundant to do the same thing over and over every year because it's been changing it. And I kind of have to agree with that on both instances. That I like Dr. Turchi, licensed in Oklahoma, and every year I have to find something on the Oklahoma license website or read their Practice Act that has a section in it on controlled drug substances and record keeping on it and that kind of thing. So, but to have every practitioner having 2 hours, I think that's, I just don't know how feasible that is. To require 2 of their 20 hours be the same thing year after year after year. I'm more inclined to try to have a voluntary sign off on our license application, and with that, give them some options of what we were talking about them reading. So dispensing, logging, or storing, and safety of prescribing controlled drug substances. So I think the veterinarians as a whole dispense a tremendously lot smaller amount of controlled drugs than our medical professionals and the human people do. But I'm not going to say that there's not opportunity for accidents or abuse or misuse, rather. Dr. Underwood, what are your thoughts?
I don't necessarily think it needs to be race approved, and I don't think it necessarily needs to be every year. I know, like in Florida, that's what I was just looking up. I think that theirs is like every 2 years, and they actually class online.
Yeah, I think an every other year requirement, unless we really beef up some database or website capability. I mean, I think that would be a real thing for me to keep up with. I don't know about Florida, but they may be on an every other year renewal cycle also. So some states do renew only every other year. But I think since we renew annually, I think an every other year requirement for controlled substances would be really difficult in the back office to keep up with that.
Well, could we put something in there like Oklahoma does, and you say 2 hours must be education or review of regulations pertaining to controlled substances, and just sign off on it like you do on Oklahoma? I mean, it's going to be an honor system, deal. Did you actually look at it or not? But
Right.
Dr. Parker's already said, it's redundant to have to do it every year, but really not a lot of changes. So you end up reading the same material over and over and over, whether it's the Practice Act or you have the DEA website. They don't speculate what it has to be, but you just have to review controlled substance. And I think that maybe they do give you some directives on where to find it or what it needs to be. But yeah, you're right. There are some, like I know AVMA, and there are some other sites, like I know Dr. Ward is doing a survey. It's not a continuing education deal, but those things are hot right now just because it's an issue. But 3 years from now, are you going to be able to find anything, at a meeting or online or whatever? So if the doctors did it, maybe there's a way to tie into whatever they do. But
Yeah, well, and I know we do the prescription drug summit. We approve that usually every year I mean, I don't think there's any requirement that it has to be race approved. That's however they can get it in time.
well, if we leave it like it is, what we may have to do then is send a letter out through the Arkansas VMA or us one saying that, that it does not have to be race approved. You've got to, verify that you're doing some kind of education 2 hours a year.
I think it may be acceptable for us, like if they want to read the DEA laws, or if they, kind of like you said, Oklahoma does. I think if we maybe give options of what's acceptable, maybe they'd feel better about that. Or
now,
maybe you don't like.
Will we redo our? If we do this, we'll have to redo our application for renewal and put that as a line in there. On the back where we do our CE, it says, so many hours of this, so many hours of that. Would you put another line in there that says, 2 hours of controlled substance, and actually have them list what they did for those 2 hours, just like you can read peer-reviewed articles. I mean, that can be part of your CE, but
I think, well, the majority of folks renewed online this year, so I did not get, I mean, I did get paper forms, but certainly most everyone renewed online. So I think there is probably a way, I mean, they could with that through the.
I mean, they could just go there and edit the site and say, hey, here's a line you gotta fill out. So
Yeah, right.
Dr. Turchi, what's the exact wording on our Oklahoma license that we read every year? Do you have that there in front of you?
I may can find it. Let me look right quick and see.
Because I know every year that before I renew that, I have to, again, online or in their practice act or both, pull up something to read or review. It's always a review, every year review.
Yeah, let me step away just a minute. I think I've got a copy of that. Let me step up in the front office. I'll be right.
Okay. I guess I'm wanting something to be done. I guess I like the fact that myself, I'm kind of thinking because if we required a CE 2 hours, it's all on the honor system. It's all voluntary. They could say they went to a certain class and they didn't. We want to think that everyone would. The same thing on, hey, can you certify that, you read 2 hours of study on controlled drugs, substance storage, logging, dispensing, side effects, whatever, as a voluntary, not a voluntary statement, but just a statement on there. We were doing that again in a show of support and hopeful education in the epidemic, crisis epidemic. So I guess I think that's more of I would think that would be more logically speaking something to do than require 2 of our 20 hours classes that are going to be maybe hard to find.
So would you suggest just taking it out at this point?
Yeah, I would like to hear what Dr. Turchi says the statement is first, but yeah, I'm almost thinking take it out and replace a line item on the front of our license renewal that says something similar to, we want you to get 2 hours, and can you testify that you've gotten 2 hours of study on this and check it. If not, they'd be like me, well, no, I haven't this year. Better do that and sit down tonight and pull it up on the internet and read something and then certify it. So, and if they go to a meeting, a large meeting somewhere, and they have an hour on controlled drug substances, they can elect to go to it. But what'd you find, Dr. Turchi? Anything?
I could not find. I thought sometimes I'll make a copy of that on how I filled it out so that I keep it in my record, but apparently I didn't do that. I was going to look under the Practice Act right quick and see if it says anything about CE.
I know I have a copy of that at the office, but not here at the house.
Yeah, I thought I kept a copy of it because you have to, but obviously I didn't.
Well, I thought we discussed with the Arkansas Board, Veterinary Medical Association Board, or at least with Maggie, that there would need to be an offering of this at the annual meeting so that people would be able to comply with this. And while I think requiring 2 hours every year is a problem, I can see that if you did it every other year, every third year, you would have the database problem that Carol referred to of trying to keep track of that. But my observation is that the last time the vast majority of veterinarians in the state got any instruction on this was when they passed their written exam. And if there's not some incentive, they're not going to be that aware of it. And I don't know that it needs to be every year, but it certainly ought to be up there enough every third year or something like that. Would make more sense to me. It's just like your accreditation. You know, if you're going to keep your accreditation, you've now got to take courses every 3 years to maintain that accreditation. And it seems that, particularly in regard to controlled substances, this is something that we deal with as a board fairly often, at least since I've been on the board. We've had cases directly involved with this, with individual veterinarians having substance abuse problems.
Here it is on the Oklahoma license renewal. It says a mandatory review of the controlled drug substance laws. 2 hours of the 20 hours shall encompass state or federal controlled dangerous substance laws or a review of the Oklahoma Practice Act and the applicable rules. 2 hours required. And so that's where you either one, you have 2 hours that you list as CE, or you list that you have 2 hours of review, it could be CE at a meeting somewhere, or it could be CE that you read online or an article, or it could be 2 hours of CE reviewing the Oklahoma Practice Act and the applicable CDS rules. So basically you say you've done one of those things and you put down 2 hours. So, and
well, there's nothing in this regulation that says it has to be class hours.
Mm-mm. Yeah, I think it can be any. I mean, I think any, because all it says is let's see, what did we say? 2 hours must be education pertaining to controlled substances. So it's pretty open on what that might be.
Well, if we modify it and we say that could be classroom hours, that could be scientific article reviews, that could be, it wouldn't be scientific, but anyway, it could be controlled drug substance, that state and federal law reviews of controlled drug substances. It could be review of proper labeling, storage, dispensing.
Well, I don't, I mean, we can. I'm not sure that that necessarily has to be added to the rule itself, because we have, you know, down further in the rule, how they can be obtained. So through online hours or classroom hours or anything like that. So I don't think we have to be that specific in the rule, but if we wanted to have a statement that we would send out, you know, that would give examples of what would be acceptable for this type of education, I think maybe we could do it just in a letter that would go out to licensees, letting them know maybe what options they have.
I don't think we want to get into a situation where, as a board, we're creating education courses.
No, I don't, no, we cannot create CE courses because I do not have the resources to be able to do that. But I think if we want to let folks know that, you know, it is acceptable to read you know, rules of the DEA, or it is acceptable to read, you know, what we have in our Practice Act regarding controlled substances. Let folks know what is acceptable to meet that requirement. I think we can do that through communication without it in the rule.
Well, as the objections, the way that I read the objections, it was, they were objecting to having to do 2 hours every year.
Yeah, and that not, you know, not all veterinarians use controlled substances and things like that. So I think there's an element of, you know, if I don't use controlled substances, why do I need to be educated on them?
How many veterinarians are practicing without a DEA license?
I wouldn't have that information, Dr. Bird. I don't know who and who doesn't have a DEA registration.
Well, unless you're doing regulatory medicine, I can't imagine anybody not having a DEA license or working at a clinic that does.
Right. Yeah. It may not be the individual that holds it, but sometimes the clinic will hold it and everyone will work off the one. So that's a scenario for sure.
And everybody at the clinic, sort of like the one we just had on record keeping, everybody at the clinic needs to know what what the requirements are. And I think that's what we're trying to get to.
Well, I guess to kind of pull us back to the rule, you know, I guess I'll make a decision based on the comments. Do we want to leave it or do we want to take it out?
Dr. Turchi, leave it or take it out?
My gut feeling is take it out, because I just think it, and you know, I mean, it's a hot topic now, and it's being covered, and I'm sure everybody's being made aware of it. But if you're renewing, if you've got a DEA license, you depend on practice with, you've got to be, you know, crossing your T's and dotting your I's to you know, to jeopardizing that. So I just think, you know, I can understand all the comments that have been made, you know, and it, you know, my deal is take it out. My opinion is take it out.
All right. I guess if I had to say, my initial instinct is take it out. Dr. Underwood, what's your thoughts?
I think it'd be easier to just take it out. I mean, I think that, you know, the Florida license has had it for at least 40 years. But I mean, if we're going to get a lot of flack over it, because they can just say, oh, well, I did that. I'm not paying attention to it.
Okay, Dr. Bird, we got 3 people say take it out. So I guess I understand all your concerns. So I'm going to say I'm going to make a motion for right now. We take it out.
I'll second it.
Okay, there's a motion and a second. Any further discussion?
I could live with it. You know, I think the bigger picture is not just the controlled substances. It's awareness of the Practice Act, regulatory requirements. You know.
All right, if there's no further discussion, then all those in favor of the motion say aye.
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 Aye. Aye. Any opposed? All right, Kara, for now, we're going to take it out.
Okay. And then the other one, I guess, if y'all want to address it, we took out the hours for exhibit hall, and I think we did that because, again, it's not totally on the honor system, walking through the exhibit halls to get, CE hours. There's no documentation of it. And so, of course, we had one comment from someone who they like that. They like being able to use gain CE in that way. But so I guess, I don't know, what are y'all's thoughts on that?
Dr. Underwood, take it out or leave it in?
Are we
Yes.
talking about, I had a break in my connection
Oh,
there. Prescription monitoring, the prescription class.
No, we're talking about the exhibit halls.
I know a lot of other states leave it in, give so many for the exhibit hall.
So, Dr. Turchi, are you in favor of having CE hours gained by exhibit hall attendance or not?
Yeah, I guess you could go either way. Some people have kind of probably depended on it. At meetings, sometimes you feel like you got to be at every meeting to sit through it to get my hours. But if you can visit with somebody on a new piece of equipment in the exhibit hall and learn some more about that, then I don't have a problem with that. So I'd say maybe leave it in, put it back in.
Okay, Dr. Bird, what do you think?
Well, it's not in the proposed deal now, so you'd have to put it back in.
Right, yeah.
And I don't have a problem with it being put back in.
Okay. All right, we'll make the motion that we allow 2 hours of CE for visit hall attendance. Is there a second?
Second.
Okay, any further discussion?
Can I ask real quick, just from one of the attorneys, these two changes, are they going to require us to go through the public comment period a second time?
If the changes are a natural flow from public comment received and they're not substantive changes, probably not. But I really couldn't tell you whether these would be considered substantive changes unless it was challenged by a court.
So we don't know. Is that what you're telling us, Mr. Nye?
Yeah, essentially. But how likely are these rule changes to actually be challenged by anybody? It's probably a pretty low threat scenario. I think as long as DLR understands that it flows from the public comment, we should be fine.
Okay. Does that satisfy your question, Kara?
Yes, I was just curious.
Okay. So again, I think there was a motion and a second. Is there any more discussion? All right, all those in favor of still allowing 2 hours of CE for exhibit hall attendance, say aye.
Aye.
Aye. Any opposed? Motion carries. Is there another one, Karen?
I'm going to get myself off mute there. Yeah, so the next rule that we received public comments on, that was the veterinary technology level of supervision rule. And so to break the types of comments we had 2 comments that were regarding really where to find the definitions of immediate, direct, and indirect supervision. Of course, those are in the statute. But I think one commenter really wanted those definitions to be in the rule, which typically we don't copy statute to rule. We had 2 really positive comments about the overall addition of this rule. So that was kind of nice to have. And then we had 1 comment that we received, was a longer comment, multiple concerns within that. And those were, they felt that the rule did not specify that this rule was for certified technicians and technologists. They felt that maybe this applied to just anybody who was a trained assistant, which it doesn't. And then they felt that the role allows a technician or technologist to perform diagnostic imaging without training or oversight by a veterinarian. Finally, they felt that the technician or technologist performing ultrasonography should be required to meet the standards of the American College of Veterinary Radiology. So that was a pretty long comment that we received, and I think those are the three main concerns within that comment. So
Okay, so all these comments are about ultrasonography.
That the one that I just described really was directed just towards the diagnostic imaging and ultrasonography, which we have in the role under indirect supervision. That person was also concerned. I mean, I think they were unsure who this role applied to. We have in the very opening paragraph that this is just for certified technicians and technologists. It seemed that they were concerned that there was no veterinarian, overseeing this. None of this can happen without some type of, because they're the ones that have to give instructions for these things to be performed. So I think there were maybe just some misunderstanding with what the role was and maybe how it worked with that particular comment.
Okay. Concerning go ahead, Dr. Bird.
The way I read her comment, she wasn't going to be happy with anybody performing these that wasn't board certified. And I think our rules that we've adopted here specifically specify that no matter what level of supervision it's under, it has to be the direction of the veterinarian. Just because they're listed doesn't mean they got carte blanche to go do them. It still falls back on the veterinarian because it's his license and insurance that are directly responsible for all of this. So I don't see a problem with it, the way it's written.
Okay, so Dr. Bird, you're in favor of leaving it the way it is. Is that what you'd say?
That's correct.
Dr. Turchi, are you in favor of leaving it the way it is, or do you think ultrasonography needs to be in a different category?
I'm like Dr. Bird. It's ultimately it's going to be ultimately the doctor's decision. I mean, and if you've got a technician that's been around for a long time and they're really good at shooting radiographs, lining them up and getting views, or they're really good at ultrasounding a specific part on the body, it's still going to be ultimately up to you to be there and review those images. And if they're not what you want, then you send them back to do it, or you do it yourself. But it's under some type of supervision. Like Dr. Bird says, it's ultimately the responsibility of the veterinarian. Is going to fall back on his license. So I don't have a problem leaving it in.
All right, Dr. Underwood.
I have no problem leaving it in here, but I actually have had a conversation with this individual about this particular subject here, and she definitely feels that ultrasonography should not be done by anyone that is not board certified or had numerous training under board certified individual.
Okay.
But I'm for leaving it in. I've had a conversation about it.
Okay. Well, I've read the individual's comment.
I mean, most veterinarians aren't board certified in radiology or ultrasound. So, I mean, what is her, I mean, does she feel that?
She feels that untrained individuals should not be doing ultrasound because they make incorrect diagnosis.
Yeah, but
That's all, but
the
that's what,
diagnosis is, yeah, the diagnosis is ultimately up to the veterinarian based on the images they captured, not that they're going to make the diagnosis. So, yeah, so.
Well, I've read the individual's public comment. It's lengthy. I understand what she's talking about. However, it all gets down to the supervising doctor's comfort level with a technician or any technician doing any ultrasound for that type of doctor. And so it's basically where it is. It comes down, it's the doctor's choice. The person who wrote the comment, it's not her choice. Dr. Underwood may have a technician that she says is comfortable in doing ultrasound cystocentesis on cats, okay? And she may not. It would be her choice. So I guess I'm fine with leaving it where it is. So the way I'm taking it is we have 4 votes to leave it where it is. I make the motion that we leave it where it is. Is there a second?
Second.
All right. All those in favor say aye.
Aye.
Aye. Motion carries.
Yeah, and I guess, I don't know if we need to address this one, but there were comments about wanting the definitions in the rule, and I don't know, this may be more for the attorneys, but I mean, correct me if I'm wrong, but it's not typical to have definitions found in statute copied to a rule.
No, I mean, it doesn't harm anything to copy them into the rule. It's just unnecessary. I mean, the statute is what governs. All rules are supposed to be read harmoniously with the statute where they can be. So whatever definition or whatever words are used in the rule has to be defined as it is in the statute. So it's kind of redundant. Some folks like doing it. If you're creating a new definition that's not found in the statute, you're going to want to put that in the rule, and you'll want to be careful with that. Yeah, it's fine either way, and personally, I like it without the definitions when you can get away with it.
There was one of those letters that I could not read.
Oh, I think it came out really dark. It was from, I think, yeah, I know which one you're talking about. I noticed that it came really dark whenever it was copied, but it was that was a very positive letter, really with nothing but good things to say about adding the rule.
Okay.
But I can try to send you a better copy of that, Dr. Bird.
Okay, I'm going to make the motion that we leave the definitions of the levels of supervision in the statute and not copy them to the rule. I guess I'm going to, is there a second?
Second.
Okay, so we've got a motion and a second to leave the definitions of levels of supervision just in the statute, and a second. Is there any discussion from any of the board members concerning this matter? Okay, all those in favor say aye.
Aye.
Any opposed? Okay, we'll leave it where it's at.
I just have one question though along that. We're changing the Practice Act and our rules, and we do have these statutes that refer to all these things. And I don't think those are all gathered into one place. It would be nice if those were codified, published in some format where you could have immediate access to those, because I don't think just reading the rules without some of those definitions or some of those things in the background, just like with this reciprocity deal, I'm sitting here going, I don't remember reading that thing. If we received it, I don't have it in my pile here because I've been looking through what we've got the last several months, and I don't see any reference to that. So I don't know how the veterinarian who's not on this board would have any direct knowledge of that, and expect them to read the Arkansas Code of Annotated regulations and acts is expecting something that's unrealistic.
Yeah, Dr. Bird, maybe to address that, I've got a copy of the Practice Act and the rules posted on the website. Of course, those will be updated. So once we get all these rules through and they're in effect, I'll be updating that document. The Practice Act, I could probably go ahead and try to get an updated version. I don't think I've done that yet, as far as getting that posted on the website. So I can definitely get that done as well. And then as far as the things like the new law about reciprocity and even some of this military stuff that we're going to talk about in a minute, those are found in like other parts of the code, not specifically in our section of the code. So we may have to think about that a little bit. But I agree that that part would not necessarily be easily accessible if you didn't know where to look.
It would be almost impossible.
Yeah.
I would think that even most attorneys would not be able to immediately access that material, much less a veterinarian who's not trained to look at those sorts of documents. I mean, that's not part of our education.
Right. Yeah. No, I
So
understand.
whether, particularly since you're doing it online, you know, if there's some way to make a hyperlink or something that would take a person to those definitions and statutes, seems to me that would be advantageous.
Yeah, Brad or Michael, y'all might know. I know that, and this may be through the BLR website, but there should be a link to LexisNexis BLR, correct? That's like public access to the code. Or
Yes, there is.
They're also developing a similar thing for all the rules. So you'll be able to search for all the board's rules, and you'll be able to search for, you know, throughout the code, your heart's content.
Okay. So it sounds like that's something maybe they're working on to make more accessible to the public also. So, okay, but yeah, no, I agree, Dr. Bird. It's hard to find some of that stuff. So I think, are we ready to move on to the next rule? I got one more here. Yeah, the military automatic licensure, and I'm going to kind of let Brad take it away at this point. I know the AG's office, Mr. Berry, who sent this comment in, I think he sent that to lots of different people, and I think the AG's office has reviewed this, and so I'm just going to let Brad take it away and explain.
Yeah, sure. Thank you, Kara. So Act 820 passed during the 2019 session that put in statute this requirement for automatic licensure for returning military veterans and their spouses in active duty military. The statute basically says that if I move with my spouse to, say, Jacksonville Air Force Base, and I hold a substantially similar veterinary license from another state, by the mere fact that I am married to an active duty member of the armed services, I should be able to automatically get a license with the board here in Arkansas. The statute doesn't actually require any rules to go along with it if you're using the automatic licensure provision, but the sponsor of this bill had gotten upset in the past because boards had not been promulgating rules. So our office was of the opinion against our normal feeling of not putting statute in rules, that we would go ahead and codify the statute in the rules to satisfy those concerns. So the rule as went out for public comment is almost a verbatim copy of the statute. However, Colonel Berry, who's retired military and who represents veterans' families, essentially, it's an association based out of Jacksonville Air Force Base, had some concerns that if we didn't clearly define certain terms that were already in statute, that it would give room for some agencies to potentially interpret it differently. So through negotiation with counsel over at the Department of Health, who has been involved with Colonel Berry in the past, we had worked out an arrangement that if we added in the definition of automatic licensure into the rule, even though it's defined in statute, that would satisfy his concerns. So after conversation with attorneys in our office, we decided that would be the best outcome in this situation, would be, as a result of his public comment, just add in the definition of what automatic licensure means and push it forward for review. And so we think that should satisfy Colonel Berry's concerns. We think if we don't add that language in, he would probably show up at committee and have some testimony. So we think this would just be a much easier approach to take.
After I read his comment, I didn't see that what we had adopted was going to be strengthened in any way by any change that's in there. It covers it all right there.
I would agree with that. Colonel Berry is not an attorney, and he is, he's reading the rule from a non-attorney perspective. I think he may be a little confused as to what the rule does and how you read the rule in conjunction with the statute. But the Department of Health counsel that I've been working with him has had lengthy phone conversations, and we're confident that just adding in that additional definition will satisfy them.
Yeah, and
So what's the proposed change from what we've actually got written down?
Sure. So what we would do is add in, let me pull up the exact language here. Our rule does not include this definition. The definition in statute for automatic licensure says, so we'll add this definition. Automatic licensure means the granting of an occupational license without an individual's having met occupational licensure requirements provided under this title or by the rules of the occupational licensing entity. So in other words, pretty much a veterinarian is a veterinarian is a veterinarian. So if you hold a license in good standing from Oklahoma, you move to Fort Chaffee and Fort Smith with your spouse, you should be able to get an automatic license because you've met Oklahoma's requirements.
Well, I thought that was what you just previously said was in the reciprocity rule.
Essentially, yeah.
Yeah, I think the application process for this military automatic licensure is it's going to be a little bit shorter. Like it's a little bit more compact. We might not require as much information except for that, certification.
Kara, I think we've talked about this before. I think you've had maybe one or two instances since you've been director of the board where you've even seen something like this. It's not going to come up a whole lot.
No, it will not. I've had several military folks moving into the state, and as Brad explained, I mean, really for veterinarians, it's not a huge. There are not many barriers to licensure because the standard is kind of straight across the board. You have to be a graduate of a particular type of school and pass the national exam. So in other occupations, because the standards from state to state are all over the board. But so for us, luckily, it's very simple. And so this isn't really a big deal for us, honestly. But I mean, if it would satisfy Colonel Berry to add in this definition for automatic licensure, I mean, I guess, if y'all want to go with that, I don't think that would be difficult to add in.
Well, I think that's what we ought to do. I think we ought to take the AG's advice here and add the definition for automatic licensure. I think that's what Colonel Berry's biggest point was. I don't see that that's a problem. It's just more self-explanatory. So I'm going to make the motion that we make that addition that the Attorney General's office is recommending, and finish with that. So is there a second?
I'll second.
Okay, there's a motion and a second. Any further discussion? All those in favor say aye.
Aye.
And Dr. Bird, did you have something? Did I cut you off?
Yeah, well, I just had one question. In his letter, was that his highlight, or did somebody highlight that after it came in?
I believe that highlight
On the
was
first
actually,
page of his document, the statement that you just read, Brad, was highlighted.
Yeah, I didn't highlight it.
that highlight was reflected in his email that he sent in. He had sent the exact same comment to other boards. And so I think he knew what he was going for at that point because we'd had conversations with him. So I think he just highlighted that section.
Okay. Well, I have no objection, so.
Okay, motion passed. Okay. All right, Kara, any more rules?
That completes,
Kara?
yes. Yeah, that completes the rules discussion, I believe. So, I just really have 2 more items under other business. Hopefully we can cover those pretty quickly. I have scheduled this at 1 o'clock. So we've got about 45 minutes left, but I think we can get these next 2 items done, hopefully pretty quickly. So, the first thing is the state board exam. I think due to the current situation with COVID-19, you know, we currently have that scheduled for June 18th. And I think we need to reconsider the way we are going to administer that exam this year. You know, typically it's an in-person exam. And I think there's a few options, but I did talk to Dr. Ward yesterday just to check on the facility because we use the cooperative extension facility to do that. She doesn't know for sure. She said in the next week or so they should know, but there's a strong possibility that they will not allow folks to hold large groups in that building anytime over the summer this year. So we potentially don't have a test site for June 18th. So kind of keep that in mind as we talk about these different options. So I currently have like 45 signed up to take the state exam. That number is going to jump up past 50. I've got several that haven't passed the NAVLE yet. They're scheduled to take that. That deadline ended, so the April NAVLE has now been extended. They've got till June 30th to take that. So there's going to be a lot of folks that are still waiting to take the NAVLE. They are not eligible to take the exam until they pass that. And then of course, we're going to have more applications coming in. So it's a pretty big group that we're looking at. So a few of the options that I've thought about, and y'all may have other ideas, but possible exam options could be, number 1, just postpone the exam for a few months. We can always, you know, issue temporary permits, or people who have temporary permits, we can extend the dates on those. That'd be option number 1. Option number 2, I've talked to the AAVSB. At no cost to us, they can get our jurisprudence exam online. Applicants would take that in the comfort of their own home, and the results would be sent back directly to me. So it would be open book. And the applicant actually would be a $50 cost to them to take the exam, no cost to us. You know, they're traveling here anyway. Most of them stay overnight in a hotel before they take the exam. So to me, $50 is cheaper than having to do that. So that's another option. And then the last option, and a few other states have done this. Some states do this anyway. This is how they always do the exam. But I know Arizona typically have postponed in-person exams, and they're just doing a mail out, mail back in. It's an open book exam again, but that's the way they're handling it. And to me, the open book exam, I mean, the point of the test is that people familiarize themselves with our laws anyway. If they're having to look up the answers and answer questions on an exam, I think that, you know, they're obviously familiarizing themselves, you know, with the laws, which I think is the point. So those are the three options. I just wanted to throw those out there to y'all, get your feedback, and y'all just let me know what you want me to do.
So on option number one, temporary permit, that was to give them a temporary permit until we have another exam date, and just exactly like we've done in the past, just on a later date.
Yeah. So we could keep an in-person exam. I would assume that we'd have to postpone that probably till maybe the fall. I don't know. I mean, Dr. Ward acted like that facility might not be open this summer for large groups. So we might have to postpone till the fall. Anyone who has a temporary permit currently, I could just extend the expiration date on just within the database system. And then, you know, of course, anyone who applies for a temporary permit, it would just be issued with that new expiration date.
But temporary permits wouldn't work for new graduates because they haven't taken the NAVLE until after June 30th.
Well, the probably 6 or 7 that I have that did not pass the NAVLE the first time, and or maybe didn't take it the first time, but they were scheduled for April. I cannot issue a temporary permit to them until they pass the NAVLE anyway.
Yeah.
So they're in a little bit of a different boat, but again, that's like a handful of folks. So.
Okay.
Well, as I read the phases, you know, even at phase 3, which has got to be down the road away, phase 3 would be the first time that you could have a gathering of 50 people and no more than 50. And we exceed that with your 45 applicants and the board, much less participants, you know, that have come and made presentations. I don't see that happening this year.
Right. I just think, I don't think we should bank on it being able to happen. I just think, and that's just my personal opinion, and people are very anxious to take this exam. I mean, I have several inquiries a week at this point of folks asking for updates on what's the game plan. So people are asking me, and I don't know what the best backup option is, but I hate to bank on an in-person exam when even months from now, that still might not be an option.
Well, this is like high school graduations. You know, they're going to get a certificate, but they're going to miss the event. And to me, the biggest importance of the in-person exam is they get exposed to all the individuals who make presentations, you know, from the DEA to the association to the state veterinarian. I mean, you just go down the list. That's the ultimate benefit. And it would seem to me, and I don't know what precedent it would set. That would be my only concern. But I think if the AVSB can do this for us at that minimal a charge to the person getting the license, that would be the most practical way to go for this year. But my only concern is if we do that, are we going to set a precedent, you know, for the future? And
Yeah.
I'll be interested in what everybody else thinks on that.
Well, I think if you're, of course, everything's going online anyway, but I think if you do it one time, I think we can use this crisis as a justification for doing it that way if we want to decide to go back and do it, back do it in person later in the future. But my other thought is, and we can't do it this time around, but if we do decide to do that, just to let them, the or VSB, give it every year, then I think we'd have to redo the exam questions to make them a little more challenging and make them dig a little more. But for this time around, I probably don't have a problem with it doing it that way.
I don't either, but I think, the update from the health department. I mean, there's so much information that those new practitioners get at that annual written exam meeting that they're only going to get one time in their life.
Well, the other option would be to have all those people make video presentations that are recorded. You bring 30 or 40 applicants at a time into a meeting hall, whatever is admissible. Let them watch those videos, administer the test, then bring another group in later that afternoon. So you'd be testing on the same day. They'd be seeing the same presentations. Not those presenters wouldn't necessarily be in person unless they wanted to, but they could make a taped presentation that could be played again in the afternoon, and you could do it that way. But to me, the only way to get around it, like you said, if they're going to have all these stipulations and meeting spaces, is going to be to break it up, maybe have 2 testing sessions, smaller groups. The question is, are the presenters for those things going to want to hang around and do it twice? So,
Yeah, I don't see that we could break it into small enough groups, because you really get down to 10.
Yeah. Well, and also, like Dr. Ward said, that facility might not be available this summer. So I would be afraid of that. And even if we, I don't know, I think that would be potentially difficult.
In the test packet that you send them, Kara, with all the information, they receive all the information that's going to be reviewed for the exam anyway, correct?
That is correct. Yeah. And, yes. So I send them a copy. Well, and I could maybe do it a little differently, but I send them a copy of the Practice Act and all the rules, the Rabies Control Act, all sorts of information from livestock and poultry. So I send them a study packet. And so they have that. So if they did an exam, even if it was a mail out or if we moved it online, they would have the information in front of them. And I think by answering the questions, we would know that they took the time and familiarized themselves and looked up the information, which I think is the point. And I do agree that in-person exam is very good because of the speakers. And like probably not for this year, but in the future, I mean, we could, I don't know what it would take to pre-record some of those presentations and how we would get it done right now. But that could be a possibility. I think I also want to mention that, once we're going to have our reciprocity roll done, that is really, really going forward, going to bring down the number of folks that we have sit for the exam anyway, because there's no 5-year requirement that you have had to have been in practice, like it is with our endorsement process. And so even if you've been in practice for, 6 months or a year, and you've got this, license from another state in good standing, I mean, you're going to qualify for reciprocity with us. So potentially in the future, the number of folks taking the exam is going to be much, much smaller. So I'm just, if we do go online, and even if we went online and even kept it that way, or maybe we don't keep it that way, I think we could pre-record presentations as part of that exam process, which is something we could definitely look into.
Well, I'm going to make the suggestion that for this year, and the process to be reviewed for next year's exam. But for this year, that we go with the AAVSB administering the test online, and that upon receipt of passing grade, you give them a license.
Yeah.
Okay, I'm gonna say that's a motion. Is that a motion, Dr. Bird?
Yes, sir. Yes, it is.
We have a motion to let the AAVSB do it for us this year. Is there a second?
Second.
Okay, any further discussion? All those in favor say aye.
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 Okay. Prescription drug monitoring program, Kara.
Okay. All right. So Jamie Turpin, who is the administrator for the PDMP, she contacted me a week or two ago. She is currently applying for a grant that will allow for us to hire an inspector. What this person will do, what this grant allows them to do, is actually go and inspect the prescriptions, and just a certain number of prescriptions at a pharmacy, and compare that with the information that was submitted to the prescription drug monitoring program. Well, she contacted me because she would like to include veterinarians in this also. You know, we talked about that. This would be, and it might not even be where they show up at the clinic and, hey, I need to see these 5 prescriptions. But she said it might be through like, you know, a letter they mail out and have the veterinarian mail the information back in. But it's really for a learning experience. It's not for the PDMP to go in and sanction any errors that they find. They don't have the authority to do that. And so she and I talked about that, and but then later on, she sent me a letter of recommendation that she wanted us to write for this application. And I told her that, you know, I did not feel comfortable submitting a letter of support to the grant without, you know, the board authorizing that. And I think if they're going to include veterinarians in their grant proposal, I mean, I don't think we have control over that. But I would write a letter of support if it's something that, you know, y'all don't feel comfortable with. So, if y'all have any questions for me, let me know. I probably didn't explain that very well, but Jamie and I have talked a couple of times, so I'll try to answer your questions.
So on the most recent visits, maybe that you've had with Ms. Turpin, again, this person that they're going to be, if they get the grant and they hire this person to help with the PDMP, they're not going to be going to pharmacies and veterinary clinics and fining or sanctioning or, you know, imposing, you know, sanctions on them, like, hey, your prescription doesn't match this, and we're going to fine you, and all that. It's not like a clinic inspection or anything like that.
No, they will, from my understanding, and actually with the pharmacy, they're actually going to go in with the pharmacy board, because pharmacy board routinely inspects all pharmacies every year. So they're going to actually come up with them when they go into pharmacies. But for veterinary clinics, she said it is, I mean, quickly learning, because they're just looking for errors to explain how to fix those errors. So she said for pharmacies, they're probably going to ask for 10 prescriptions. She said for veterinary clinics, more like 5. The reason she called me in the first place is she thought, hey, this may be a really heavy lift because we don't know how those prescriptions are filed in a vet clinic. She said, we know exactly how they're filed in a pharmacy, but she said, we don't know, you know, how all veterinarians keep their, you know, controlled drug records when they dispense them and that sort of thing. So anyway, for, it's to find errors and to fix those errors. It's not to sanction. And I think if there was just some really deplorable something that happened or something they uncovered, that would go back to the board. That would, they have zero authority to do anything disciplinary.
Doesn't sound to me like she's asking for permission from us.
Well, I think she called to see, you know, initially, is that going to be a heavy lift? I think you're right. I think they really want to include veterinarians in the grant. So, and I don't know that we necessarily have any control over what they put in their application when they apply for the grant. But she was hoping to get a letter of support from the board. But I just told her I wasn't going to do that without being authorized to do that.
So would this be veterinarians that are enrolled on the PMP that they would go into their clinics, or any vet clinic, just the ones that are on the PMP?
They're going to be comparing the prescriptions to the information that was submitted to the PDMP. So.
Okay.
I don't even know if she'll get the grant. I mean, she may not get it. So, you know, there's that possibility too. But I think for today, and you may not want me to do a letter of support, and that's fine with me too. I just wanted to kind of let you know what our conversation was and what she was hoping to get from us.
Personally, I think we should decline.
Okay.
Dr. Bird, why do you think, tell us why you think that?
This, I mean, they've got potential control over the pharmacies as it is. And this just looks like an overreach in government. Just somebody sitting thinking, well, this is a good idea, we should do this. And then the next thing you know, it won't be voluntary at all. It's not information gathering. It'll be an investigative procedure that's very intrusive. I mean, it's not complaint driven. This is a new level of investigation. And I think it sets a dangerous precedent.
All right, Dr. Bird, thank you. I'm going to go ahead and give my opinion, then I'm going to ask Dr. Turchi and Dr. Underwood theirs. I guess I'm hesitant to give the letter of support, basically, for some of the same reasons that Dr. Bird just said. I think that, hey, once it, you know, it starts out as one thing, but then later, oh, it turns out to be something else. Instead of being an educational, hey, we're going to help you do a better job, it becomes something else a year, 2, 5 years from now, where it turns into more of a investigatory type thing. And it may never, but I'm skeptical that it would be more than a simple, we want to look at 5 prescriptions and, oh, you got this number wrong, a prescription number, and let's correct that. So I guess I'm hesitant to give the letter, and maybe that's just a backwards way of thinking, but I just, when there's been other grants given to some of the these type of branches, it turns out to be a lot more. It has in the past. So that's just my opinion. I'm hesitant to not. I'm hesitant to give the letter. Dr. Turchi.
Yeah, you know, I guess fortunately for me, I don't use the PMP much because I don't dispense many controlled substances. Just about everything I use controlled is used in clinic, and I administer it. So, you know, I've not gotten I've not had to comply much with the PMP. So at this point, if they were to come into my clinic and say, hey, you know, we want to look at you, well, I don't have anything because I don't dispense anything. And my question is, well, why are you on the PMP? Well, if I do, and I'm like you, it's kind of, it would be to me intrusive to come into my practice and ask to see prescriptions and stuff when I really don't do that kind of stuff. I registered for the PMP thinking that, you know, yeah, if I do dispense something or if I call in a prescription for something, but we don't use that much controlled substance in horses like you do, or seizure control in small animals and stuff like that. So I'm kind of along your line. You know, if you're PMP and they're going to come in and if they're going to go online and audit your account, that's one thing, or audit your entries, that's one thing. But to come into your clinic and start asking for, let me see your prescriptions, you know, and see if they match, I don't see that's a necessity. I mean, if they want to audit online, that's one thing. But I'm like you, I don't see that they need to be sending inspectors into clinics.
All right, Dr. Underwood.
I agree exactly with what y'all say, because right now they kind of monitor anyway online with what you do, because if you send prescriptions and stuff in and the addresses and things don't match up, then they kick it right back at you. So no, I don't want them in my office.
Okay, so I'm going to make a motion that we decline to send the letter of support. Is there a second?
Second.
Okay, any further discussion? All those in favor say aye.
Aye.
Aye. Okay. Kara, what's the next thing on our list?
I think we just need to schedule the next meeting. And so I think for the immediate, maybe we just need to figure out what date we want to do as we meet with Dr. Drosky. And y'all may want to go ahead and schedule another regular meeting. That's up to y'all.
Well, typically, our next meeting would be the written exam. And I think when the meeting with Dr. Trotsky is concerned is going to be pretty much driven by your administrative efforts.
Yeah, I think y'all mentioned earlier that you'd hope to do that in the next couple of weeks. So I just think while we're all here, it might be easy just to go ahead and pin down a date for that.
How about a week from today?
Next Thursday?
Next Thursday.
The 7th.
Thursday, May 7th?
And this is just going to be a teleconference, right?
I
Oh,
think
yeah.
Zoom. I think we'll do a Zoom.
Okay.
But I don't think, I think what I understood is that this is going to be a discussion with her.
Okay. I don't know about the rest of you, but I'd either like to do it first thing in the morning or over the lunch hour, because anything else is going to kind of be hard to, since it's not going to take like half a day like this. I'm assuming it's probably going to take 30 minutes maybe. Are we looking at much more than that, or do you think, Dr. Parker?
No, I don't think. I'm hoping not. First thing in the morning, Kara, when can we start those meetings first? What time in the morning would we feasibly be able to start one?
I mean, I can get up as early as you need me to.
Not that early, but like 8 or 8:30. Could you do one that early, or I don't know.
Whatever your preference is. I mean, I would say maybe not like 8 o'clock, maybe like 8:30. Give me like a little bit of time there.
Okay.
When's your lunch hour, Dr. Turchi?
I go to lunch from 12 to 1:30, so I got an hour and a half there.
Okay. How about
We could do it from 1. We could do 1 to 1:30.
How about 1 to 1:30 next on the 7th?
That sounds good. That worked great for me.
Kara, do you think you'll have the latest drug test results back by then?
I think I will. I think it only takes a few days to post. And I reached out to the customer service folks, this morning to see if I could confirm whether or not she actually showed up at the facility yesterday. And she said she tried to call, but no one answered at the facility. So she's going to try again this afternoon. So, but yeah, maybe hopefully by next Thursday, I think I should have the results.
Okay,
You
perfect.
think you can reach her and get that scheduled in that length of time?
Well, I've got her phone number and her email address, so I can do my best. But I mean, I can't, guarantee that she'll call in.
Right.
Okay, why don't you attempt to arrange it for the 7th? And if there's a failure in the ability to make the meeting, you're just gonna have to let us know.
Okay. Okay.
And if the meeting's not gonna happen, then the earlier that you let us know, of course, the better.
Sure. Yeah. Yeah.
So we're setting this for 1 o'clock on the 7th?
Yes.
And
Yeah, and I don't think there's anything that I really need to prepare besides just an agenda with some items. I think this is just a discussion, correct?
works for me.
Okay.
Yeah, because we're not going to be, again, we're not going to be imposing a new consent agreement. I
Right.
don't believe, right? We're not going to be suspending her license. I guess we're going to impose upon her that we reevaluate this in June. And but I guess the answer to your question is yes, Kara, it's just a discussion.
Okay.
Okay.
I just wanted to double check.
But after the discussion, we would make a decision on whether to ask for an additional consent agreement or to go for a formal board hearing.
Sure. Yeah, Dr. Bird, y'all could discuss that amongst yourselves and decide which way you wanted to go. You could discuss it then. You could discuss it at a later time. That's completely up to y'all after whatever you gather from a conversation with her.
Well, I guess I'm trying to anticipate, we're going to get her on the phone and we're going to say, okay, why did you miss those dates? And why do you think you can continue to miss dates and not call in? Did you not think we were serious when we formulated the original consent agreement? Or, is this a game you're playing? Are we playing the game with you? Are we scoring correctly? I guess I'm a little confused. As our course of action and what we anticipate we're going to get out of this discussion.
Mr. Bynum, do we or do we not have the ability after this discussion to offer a different consent agreement?
Yes, sir. And in that vein, you actually have, and this is kind of technical way of reading it. I guess you have two options. One, you can amend the existing agreement, which, if you wanted to keep the rest of it active, you can do that. If you wanted to have a superseding agreement, you could have a second consent order. If you decided to go, and I'll also defer to Brad if he's got an idea. Typically, whenever with previous state agencies, whenever we have had an existing and active consent order, typical requirements on a particular individual, we would amend the existing agreement, and that would be signed by both the parties.
Okay, do we have, after this discussion, the ability to suspend our license if we are very unhappy with what we hear?
If you're very unhappy with what you hear, Well, you'd have to look at the terms of the consent order and figure out which ones she has violated, and then see if that, compare that to the Practice Act. And then, based on comparing the evidence with the law, move forward with what you think would be appropriate. In this case, license suspension. I would imagine, without digging too deep into it, that violation of the consent order resulting from a disciplinary action, or in lieu of a disciplinary action, would probably get you there for a suspension. Now, we still have to go through putting on the case and showing exactly which sections of the Practice Act that she violated. But that's just like any other normal hearing.
Yeah, so it's we add, subtract, or change the existing consent agreement if we want to, or we do away with it and get a new one. But if the thought was it's been such a bad deal for us that we felt like we were going to suspend her license, that would mean, well, after the discussion, we call for a formal hearing.
Yeah,
Okay.
if you feel like a consent order will not achieve your objectives, which is to, from what the sound is to get this person back in compliance with the Practice Act and to abide by the terms of the existing consent order. If that's all going to be fruitless, you may want to consider going straight to suspension. But if you believe that there is a chance to get the result you want out of a change to the existing consent order, a new consent order, and that's what I'd recommend.
Okay. Dr. Bird, does that answer your question?
Yeah, sort of. I mean, it seems to me that we're spinning wheels. The only thing that I can see that could come out of this where we would extend it or rearrange it or whatever would be some report from Dr. Beard saying, okay, there's extenuating circumstances here or something, and I'm satisfied that she's making progress and complying, and she's cooperating with me, because she's certainly not cooperating with the consent agreement as it currently stands. And I think we're doing, again, a disservice to her and to the public to allow her to maintain her license when she's not fulfilling the consent agreement to the T.
Well, Dr. Bird, look at it this way. If I were to send out a notice and order of hearing today, it would still be 30 days before we could take action. If we're going to have a conversation with her next Thursday, I think there's no harm in that. That only puts off the ability to have a hearing by one additional week. We'll still be able to move forward against her as quickly and expeditiously as we can.
I don't see I don't see what we're going to gain unless, and what I hadn't heard is that Dr. Beard has communicated directly to Kara for the board's consumption that he's pleased with our progress in spite of her having missed those dates.
Kara, do you think before this discussion with Dr. Drosky that you can, number one, forward to us a copy of the original consent agreement, and then number two, have a discussion with Dr. Beard and get a statement from him about what the status is, his relationship with Dr. Drosky is at this point, and then third, a copy of the drugs test that she hopefully is having this week.
Sure. Yeah. Yeah, I can do that. That's no problem.
Let's try to have those three things for our board members before the discussion, and then we'll talk with her and we will see what we think.
Okay.
Okay, that date will work for me.
All right, so next, unless Kara notifies us differently, it'll be a Zoom meeting. I'm sure she'll send us an invite to that for May 7th at 1 o'clock.
Okay.
Okay. All right. Is
Be
there any
there.
other business that we have, Kara?
No, I think that's it. You know, I think we can go ahead and assume that the June 18th board meeting is canceled at this point because we're going to not have the state board exam that day. So if there was anything else we needed to do, if y'all want to go ahead now and figure out a date for a new regular board meeting, we can do that. Or we can think about it over the next week and decide next week, whatever your preference is.
How many, do we have any new complaints?
I do have two.
How many?
Two.
Two. Oh, okay. I thought you said a few, and two. Okay. Okay.
So, I mean, I personally, I don't see the need to have a meeting so quickly in June since we've had a pretty good lengthy meeting today. We'll be doing that next week and potentially be looking at a hearing date. So for a next regular board meeting, I mean, we might, I don't know, August or September. Since we really only meet quarterly.
How about August 12th?
August 12th would probably work for me.
Is that still going to probably be a Zoom meeting or probably?
I don't know. I guess we'll have to wait and see.
Okay.
I suspect it will be.
Yeah, it might be, but that's fine. I think this went well. So y'all wanna go ahead and August 12th, and you know, if we have to change it, we can.
9 o'clock like we did this time, or?
That's fine.
Dr. Underwood, is it working for you?
It is right now.
Anybody opposed to August 12th? All right, let's say August 12th.
Okay.
We've got time to change it if it doesn't work out next week.
Sure.
Somebody can sign and let us know.
Okay. And I think that takes care of it.
Okay, nothing else on the list, so I'm going to say that we're adjourned. I appreciate everybody attending. Kara, Mr. Bonham, everyone else, I appreciate all you do. If you need something, then holler at us, okay?
Thank you, everybody.
All right, thanks.
Everybody be safe.